You know, we
This
know
meeting
all her
is being
accomplishments.
recorded.
And one of the ones that I think is just so always uplifted me. She uplifted all of us. Her optimism, her positivity, her just joy for trying to make our system better and connect with peers throughout the state. I had the privilege and joy to be able to travel and with her when we would go on commission meetings like many other commissioners and connect with our peers in the community and just be in the presence of, you know, the effort to help improve our system. And she never stopped doing that and is missed dearly. So thank you for this time to honor her.
Thank you, Commissioner Templin. Commissioner Rowlett, please.
I met Tina many years ago after she had informed me that she had applied for a position at Turning Point Community Programs, the agency in which I've had the unique privilege of working for 40 years. Both former Commissioner John Buck and CEO at the time, and I were flabbergasted that we had missed the opportunity to work directly with Tina. The rest of the state was fortunate in that she became the consummate advocate for all that is good in behavioral health. Our paths continued to cross, and we had the pleasure of working with Tina on many projects, including the passage of the Mental Health Services Act. Tina enthusiastically embraced the effort from the beginning, and she even opened her home for us to come as she rallied constituents to talk about the importance of passage of the act. On that occasion, John and I had the unique privilege of meeting her husband and her daughter. Tina was very proud to be a mom, a wife, and a parent. We were not surprised that her hard work, her modesty, and humility resulted in her becoming a commissioner. As a commissioner, Tina did all the things that were just mentioned and did them with grace, earnestness, wonderful, exemplary success, and with a type of passion that was unequaled. In doing so, I think she tirelessly and thoughtfully articulated that selflessness in this work was a part of what she believed in. I will, and so will former Commissioner John Buck, remember Tina's devotion to her family, her strong principles, and everything that she believed in this work for the people that she was so privileged to represent. Thank you.
Thank you, sir. Commissioner Brown, please.
Thank you, Mara. I just would like to add my my comments. Tina and I come from Santa Barbara County, and we often would travel up together to the commission meetings. I got to know her as a friend as well as a colleague. Everything that's been said about her is spot on. She was indeed filled with grace and kindness. She was a shining example of someone who overcame tremendous challenges and difficulties with mental illness. And in doing what she did on the commission and with her work, both at the Behavioral Wellness Department in Santa Barbara and also her previous positions, as just mentioned, she really put the spotlight on the importance of peer support and people with lived experience really being integral to the recovery process. She was a shining example of someone who could overcome some incredibly difficult obstacles and not only do well, but shine. And she was someone who I think all of us who were privileged enough to know her and have the opportunity to work on this commission with her, we're all touched by her. And I think, you know, I had the chance to say goodbye to her in her final days, and not kind of knowing what to expect. I walked in and was just really delighted to see that although she was stricken physically, she had all of her faculties. She had her sense of humor. She had her sense of optimism still. She was, at the end, just the way she was as she went through life. And she was brave and she was inspiring. One of the greatest things, I think, was the opportunity to get to meet her husband and her daughter. And her daughter is really stepping in to fill her shoes. She's chosen a pathway to a career working with people with mental illness. So it is just, you know, a continuing legacy that will be there with Fan, and as she represents her mom. And so anyway, I appreciate the opportunity to just say a few words about our dear friend and colleague. Thank you.
Thank you. And I just wanted to add, Tina was the chair when I came on board into the commission, and she was exactly that. She was friendly and loving and welcoming and invited me with open arms. We would laugh. She struggled with my last name, Madrigal. And so at one point she just took me aside and said, how about if we just go with Magical? I will take Magical all day long. Forget the Madrigal, no problem. And she loved talking about her daughter. We had, you know, I had, my son was entering his college years. And so we would talk about that. She was an avid reader. So we talked about different books, and her optimism and her positivity was something that, you know, took her every single day, just increased her days and increased her messaging. And so I will never forget that. So very near and dear to my heart. And thank you for all the words. And I see that Commissioner Gordon, you have your hand raised. So please, sir, share your comments with us.
Yes, thank you, Chair. And I don't want to repeat what's already been said, but Tina was so welcoming to me on the commission, but more than that, she was so kind in answering all of my questions about her role, what she felt about consumers in the system, and all of the things she was doing in Santa Barbara to make it a welcoming process for people to access services. And I had lots of questions along the way, and she never did not have enough time to share with me and help me as I tried hard to learn about the role that she was playing and the work that they were doing in Santa Barbara County. She was a good, kind person, and she made an enormous contribution to our work on the commission, and I know to the work of behavioral health throughout the state. So I will miss her a lot. Thank you.
Thank you. And thank you all for sharing your words with us. We will do our best to continue on without her, and we will always carry her dedication and commitment close as we move forward. If there are partners and stakeholders or members of the public that would like to say a few words about Commissioner Wooten, we welcome your thoughts and memories during our general public comment. With that, we want to go ahead and begin today's meeting. The Commission's strategic plan for 2020 through 2023 is committed to 3 strategic goals and objectives to advance the Commission's vision of well-being for all Californians. Cody, can you please bring up the strategic goals slide? Thank you, Cody. So we just always want to ground our meetings in that as we remember what we're doing, why we're doing it, and where we are grounding our work. So at this time, I'm going to make several announcements. So I will begin with this. Our next meeting's agenda will be posted on February 14th for the commission meeting on Thursday, February 24th. The November 2021 commission meeting recording is now available on our website. Most previous recordings are available upon request by emailing the general inbox at mhsoac@mhsoac.ca.gov. I want to make some comments on our committees and subcommittees. I'm happy to share that our current committee and subcommittee chairs have accepted reappointment to continue on in those roles in 2022. We thank you and look forward to your continued leadership and guidance. We do have some vacancies to fill and we will work on that. Also, as you may recall, our former chair, Lynn Ashbeck, discussed the opportunity to appoint a children's committee at the commission's October 2021 meeting. She outlined two goals. The first was to enhance the integration of the commission's work on children's mental health. And the second was to support the governor's Children and Youth Behavioral Health Initiative. Recognizing the leadership of former commissioners Ashbeck and Barrick, I have asked them to serve on this committee. I want to extend an invitation to commissioners who are interested in serving to contact commission staff to let them know that you're interested. As we work to frame out how this committee can be most effective, I will make additional appointments. At this point, I'd like to invite the chairs of our committees to make updates on their activities. So I'm going to invite Commissioners Alvarez, Tamplin, and Danovich to provide their updates. So please, if we could begin with Commissioner Alvarez.
Thank you, Chair Madrigal-Weiss, for the opportunity to provide an update on the work of the Cultural and Linguistic Competency Committee. Last month on December 8th, we met to wrap up our work for 2021. I want to start by saying how grateful I am and how impressed I am with the incredible passion of our amazing group of CLCC members, as well as the members of the public that attend our sessions. Last year, we were able to make progress on several of our stated goals. Just as a reminder, our three overarching goals of the CLCC are to provide input on the Commission's REAP, our Racial Equity Action Plan, to identify ways to document and communicate inequities in our mental health system that will inform policy and practice. And third, to identify policy and practice reforms and explore existing efforts and model programs that address inequities. Thanks to the input of our CLCC members and the public, we were able to tackle each of those in the work that we did together. I want to talk about the direct feedback on the Racial Equity Action Plan that the committee was able to provide. They shared great ideas for how we can build greater accountability within the OAC. And I'm looking forward to having the entire commission explore those opportunities as we commit to this Racial Equity Action Plan. The committee also provided really great and valuable feedback on triage funding, on how best to serve diverse communities throughout the state. And in particular, one of the discussion topics was the RFP we're going to be discussing today that will serve immigrant communities. So the purpose of the committee is to advise and to provide perspective in our commitment to cultural and linguistic competency, and that is exactly what the committee did with these two opportunities. Additionally, our December meeting included discussion and input on the OAC's efforts to advance prevention and early intervention in mental health. And at the meeting, the committee voted to approve recommendations related to prevention and early intervention, particularly around community-defined evidence-based practices, as well as prioritizing transition-age youth of color, as well as some input on our hiring practices. So it's all really valuable perspectives to consider in the work that we're doing moving forward. So Chair, as the commission looks to move forward with these priorities, I want to request that the recommendations that the CLCC put forward be discussed at a future meeting of our commission's PEI subcommittee. And then finally, the next meeting of the CLCC will be scheduled in the coming weeks. So be on the lookout for that. We are also planning to propose the meetings between now and the end of the year to ensure that we can get on people's calendars in a timely way. Again, I'm entirely grateful for our CLCC members and members of the public that attend our sessions and looking forward to a productive year together.
Thank you so much. It's a lot of work and we look forward to hearing more at the PEI meeting. So thank you, Commissioner Alvarez. And Commissioner Taplin, please.
Thank you. Yes, we're the Klein and Family Leadership Committee met on December 9th of last month and received a presentation from CFLC member Rachel Chambers. Rachel is the Chief Executive Officer and co-founder of Painted Brain, a mental health community-run organization based in Los Angeles, but serves, provides trainings throughout the state. And Rachel presented on outreach strategies to diverse communities for the implementation of SB 803 peer certification, peer support specialist certification. Rachel's presentation included the importance of peer specialists, steps to community-specific outreach for workforce expansion, and how to accommodate diverse voices in the workplace. All of this information will be included in the peer specialist resource guide that the committee has been creating. Commissioner Tina Wooten was very active and very excited about this presentation. Unfortunately, she wasn't able to attend it, but her spirit carries on through those meetings because our advocacy is not ending in this work. In the coming year, the committee will continue this effort to provide guidance and a resource to counties, CBOs, peers, and parent peer support specialists, peer supervisors, with a set of helpful resources for peer program implementation. Rachel's presentation was also followed by a robust discussion of the committee members and public on issues raised by the presentation. And the entire meeting consisted of Rachel's presentation and follow-up. So it was a really robust meeting, and we look forward to a successful 2022 meeting schedule. Our next meeting date and time will be announced in the coming weeks. And that was for the Klein and Family Leadership Committee. Also on January 11th of this month, the Fellowship Advisory Committee met for the first time, and we have a great committee that applied to join, and we had a presentation by Noah Abdenor, Peer and Recovery Services Director at Texas Health and Human Services Commission, and Colleen Horton, founder of Hogg Foundation Policy Fellowship Academy. And we discussed key opportunities for mental health practitioner and peer specialist policy fellows that will join the commission's workforce at the OAC. And we will be going through the kind of framework and guidelines and practices for these fellowship opportunities, and look forward to sharing more about that. Dr. Nathie has been a key supporter in this effort, so we're really grateful for her leadership through the commission. And for those that may not know, the fellowship there's the two fellowships, and one, the mental health practitioner, is named after our mental health leader, Rusty Felix, rest in peace. And also the peer specialist policy fellow is named after Sally Zinman, pioneer in the peer movement in California and across the nation. So we're looking forward to creating this opportunity for the commission to have two fellows join its team. Thank you.
Thank you, Commissioner Taplin. A lot has been really moved forward. Thank you for your leadership on that. Really appreciate it. And for those interested, the information is posted and the next meetings are also posted. Commissioner Danovich is not yet here for his report, so we will offer him opportunity later on in the meeting according to time, but we will also have it posted, any updates that he has for the Research and Evaluation Committee. So with that, we are going to move into public comment. So if anyone is interested in making public comment regarding the announcements or miscellaneous materials, please make those during the general public comment time. Commissioners, if you leave the teleconference meeting for any reason and decide to rejoin, please make sure to use the raise hand function so commission staff can make you a co-host again. If you have a comment to provide, please unmute your line and seek recognition when it is convenient. Lastly, if you have any technical questions, please contact Lester. At this time, I will ask Mariani to go over the public comment procedures.
Thank you, Chair. All members of the public will have the opportunity to offer comment as described in the agenda. We appreciate your patience and understanding as we learn and adjust to improve these virtual meetings. We welcome your comments. Public comment will be heard for each agenda item. Please listen carefully as I go over the public comment procedures. If you would like to comment on an agenda item, please wait until that agenda item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once the public comment period for the agenda item starts, we will close the public comment queue. The moderator will insert the word last comment next to the commenter's name or number to identify the last public comment. So please make requests to comment as early as possible. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. This is easier when we can all see the clock. We don't want to cut you off, but we do need to maintain time limits. We appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, please notify the chair and at least twice the amount of time will be given to you during the public comment period. Also, I would like to mention that a live meeting transcription or closed captioning is available for anyone participating in the meeting. If that option is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. We have had some difficulty with this technology in prior meetings, and we are working to make sure we have a backup option for those participants who use that feature when the existing technology is not working. Unfortunately, we have not been able to put that back in place at this time. Chair Madrigal-Weiss, I hand it off to you again.
Thank you, Mariani. With that, I want to welcome everyone again to today's meeting, our first meeting of 2022. Recognizing that teleconferences can be very challenging, and we've been going at this for a while now, our plan is to end approximately at 1 o'clock or soon thereafter. So with that, I'd like to begin with Maureen. Can you please take the roll?
Certainly, now that I'm not muted. Vice Chair Madrigal, I'm sorry, Commissioner Bontrager.
Here.
Commissioner Boyd. Commissioner Brown.
Here.
Thank you. Commissioner Bunch.
Here.
Thank you. Commissioner Carnevale.
Here.
Thank you. Commissioner Carrillo. Commissioner Chen.
Present.
Thank you. Commissioner Cortese. Commissioner Danovich. Commissioner Gordon.
Here.
Commissioner Mitchell.
Here.
Thank you. Commissioner Roulette.
Here.
Commissioner Tamplin.
Here.
Thank you. Vice Chair Alvarez.
Here.
Thank you. Chair Madrigal-Weiss.
Here.
Thank you. We have a quorum.
Thank you. So it is now time for general public comment. This is a time that is reserved for comments on the items that are not on the agenda. Again, I would like to remind everyone, if you wish to make public comment, click the raise hand button on your computer or the app, or if calling in by phone, push *9. If you would like to comment on a specific agenda item, please wait until the agenda item starts, then raise your hand or push *9. Once the public comment period for the agenda item starts, we will close the public comment queue. So please make any requests for general public comment now. The opportunity to participate in general public comment will end as soon as the comments from the public have begun. The moderator will insert the word "last comment" next to the commentator's name or number to identify the last public comment. So please make requests to comment as early as possible. This is a reminder that members of the public should be prepared to complete their comments within 3 minutes or less. If there are any members of the public using translation technology, please let me know and we will make sure that you have sufficient time to make public comments. Please note that the meeting moderator will unmute your line and announce your name or the last 4 digits of your telephone number. Once unmuted, we are able to hear you. Mariani, please open the line for general public comment.
Okay, we have Andrea, your line is open. You may go ahead.
There, I'm unmuted. Hello, good morning. I just wanted to touch on Tina Wooten and thank you all for your beautiful memories and reflections of the impact that Tina made on you and the commission. I want to say when I met Tina, I was in my early 20s and really was just beginning my recovery journey. And there's some things that I think folks don't realize is that when I first met Tina, she was battling breast cancer. And so she was a survivor of breast cancer when I first met her back in the 90s. And she's been a survivor of mental health challenges and just the epitome of resilience and recovery. I also don't know if folks realize that before the MHSA, back in 1996, Tina was the first client advocate in a leadership role with a county in Sacramento. And so she really is a trailblazer in so many ways. And of course, she was most proud of her daughter. And I feel that that's gave her the strength to carry on to witness Fan graduate from college with a degree in public health and a minor in psychology. She was just so incredibly proud of her. Tina would always say there's no empowerment without employment. That was her, really her passion was to ensure that everybody had an opportunity for meaningful employment and an opportunity to give back. And I've been asked to share with you that her memorial, her celebration of life will be taking place in March on the 24th at 2 p.m. And we will be, sharing all of the information with the commission so that you can share it accordingly. And I also want to say that I really wanted to invite Frank and Faye to the meeting. I think that it would be really nice to share this recording, at least at the beginning, with them so that they can hear how much Tina impacted everybody's lives and the state and the recovery movement. So thank you.
Thank you, Andrea.
Stacy, your line is open. You may go ahead.
Good morning, Commissioners. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I want to thank Chair Madrigal-Weiss so much for allowing people to speak about Tina Wooten. I had the honor of working with her a long time ago when I first worked for Sacramento County in their Department of Mental Health. Tina was very welcoming to me when I began work there and taught me so much about the client movement. She will be missed. And again, I think it's wonderful that you allowing people to talk about her. I also wanted to thank you, Chair Madrigal-Weiss, for saying that you're going to invite Commissioner Ashbeck and Barrick back on the committee, you know, because we are not in person and you have meetings, you know, that are limited by time. I really felt bad that they didn't get to have the kind of accolades in person that many of the commissioners that left were able to receive, the honors, because they both worked so hard. So I want to thank you very much for that. That's all. Thank you.
Thank you, Stacy.
Hector, your line is open. You may go ahead.
Buenos dias. Good morning, Hector Ramirez. My name is, I'm a consumer of LA County Image in Los Angeles County. I also want to thank for the opportunity to, as a public member, to have the opportunity to also express, you know, my gratitude for having had the opportunity to work with Tina Wooten. Meeting her as an advocate, as a disability advocate in the mental health community was particularly important, since there's typically a disconnect. And I think having had somebody like her for the time that she was at the commission, for all of us with disabilities, was really empowering, given the fact that at times, you know, we're really relegated to the sides, particularly people of color, which is something that she always really encouraged people to do. And with that in note, I hope, you know, to continue doing the work within this commission, to continue to advocate for Black disabled people of color, particularly residents of California, who oftentimes have had limited opportunities to participate with this commission, particularly our Hispanic population, which make up the majority of the residents of the state of California, who don't often have the opportunity to utilize this technology or even have translation services to be able to make public comment. And with that in note, I really just wanted to make a significant comment about the new fellowship position. As somebody who was invited to be on that particular committee, it is imperative, you know, that the mission of that effort be done with truly equitable efforts, and that means making sure that the people that you would invite to be in that committee actually have the opportunity to participate. As somebody who's hard of hearing and who's been a volunteer with the OAC for almost 10 years, you know, it's really difficult to be invited by the commission to participate in this and not even have the basic disability accommodations to be able to listen to what the meeting is about. And I think that really highlights, you know, some of the problems, you know, that have plagued this commission, particularly we're reaching out to some of the most vulnerable and unserved populations. It's perhaps no surprise that since the passage of this act, of this commission, we have only seen a rise in homelessness and incarceration and stigmatized behavior towards people of color suffering from mental health conditions in the state of California. It is perplexing to see why that continues. So I hope moving forward, this commission, this period of diversity and advocacy that Tina Wooten push forward, really embraces that level of access and equitability that really should belong to the people of California, particularly those communities of us who have been working through the pandemic, picking fruit in the fields, cleaning your houses, driving your house, your buses. You know, we deserve to be able to have access to all the millions of dollars, you know, that this commission hands out or approves. You know, we have been dying in droves, and we came to you during this pandemic and we're left out, you know, and even experience retaliation, intimidation, and harassment for having done that, particularly those of us in LA County. So it is not fair that as we continue to, you know, work in this particular work, the Hispanic populations, particularly of LA County, are still being left out and unheard. And I speak with the passion that Tina Wooten left us. And hopefully one day this commission will really take us into effect and really do some change to help us, instead of just, you know, inviting us to meetings where we're not even able to participate. Thank you. Gracias.
You, Hector.
Sharon, your line is open. You may go ahead.
Can you hear me?
Yes, we can.
Good morning, everyone. I just wanted to echo the comments about Tina Wooten. I had the most wonderful experience and the opportunity to work with her when I came on board with the OAC in 2014. She was the commissioner of the CFLC committee, and she was extremely welcoming, very supportive, and interested in my story, because I'm a parent of a child who had an early break when she was 13. And she was there and she cared about it. She wanted to hear about it. She wanted to know what she's doing now. And I spoke with her last on November 17th. And I just was really stunned to read that she was gone. I will miss her deeply. Thank you.
Thank you, Sharon.
Matt, your line is open. You may go ahead.
Thank you. Good morning, Madam Chair. Good morning, commissioners. My name is Matthew Gallagher on behalf of Cal Voices. I too would like to share in thanking the commission for allowing us to say a few words about Commissioner Tina Wooten. And I appreciate all the kind words that have already been said. I was fortunate enough to know Tina for most of my life, and I can safely say that I would not be the person or advocate or the lawyer I am today had it not been for Tina Wooten. She was an inspiration to me throughout my entire life. And I can share with the commission that one of her happiest days in her journey of recovery was becoming part of the commission. She was at first worried how she would be perceived or how she would fit in. And when she eventually became chair, it was one of the happiest days of her life. She really felt like she had reached the mountaintop, as Martin Luther King once said. And I want to thank you all for allowing her to do that. I know that on behalf of Tina, Frank, and Faye, she is thrilled about the work she was able to do with the MHS OAC, the leadership she was able to bring, and the lives she was really able to inspire. I know she was an inspiration to myself, to many people I know, and while she may be gone, I know she has not forgotten. And I hope her legacy and her dedication to peers, to people living with mental health challenges, and the work she's done will continue to be built on by this commission. And so I hope her legacy stays with us. I hope we adjourn in her memory today. And I hope as we tackle the obstacles facing California, we continue to have Tina Wooten in our thoughts and minds. Thank you for your time.
Thank you so much, Matthew.
Chair, that was our last commenter, but we had one more person raise their hand. Would you like to go ahead and take their comment as well?
Yes, please. We'll end with Mary Ann.
Okay, perfect. Mary Ann, your line is open. You may go ahead.
Mary Ann, can you hear us?
Oh, there we go.
There we go. I'm so sorry. Greetings to everyone. And I am very sorry for the loss of Tina Wooten, who was indeed a lovely lady. Some of you will remember me as a retired lawyer and mother of a schizophrenic adult who I used to represent mental hospitals in another state. And in retirement, I advocate for the severely mentally ill, which is the group the Mental Health Services Act was written to help. You are now reconsidering PEI, and I want to remind you once again of the mandate placed by the voters in the Mental Health Services Act, which a majority of this commission, back when you were last considering PEI, seemed to have no real interest in following. But it is a mandate, meaning it uses the term shall, meaning it is not optional. At 5840C of the Welfare and Institutions Code, last clause, and it says essentially that PEI is also supposed to be used for relapse prevention for persons who already have a severe mental illness. I will post the exact statutory language in the chat box after I speak. And I want to inform you or remind you as applicable, some of you were here, some of you were not, that the Office of Administrative Law forced this commission to include relapse prevention in the existing PEI regulations because it is a mandate. It is part of the voter approved law and it is not a choice. And I want to make sure you understand that if the commission again attempts to ignore this voter mandate when reconsidering PEI, that it will be far easier to correct that error in front of the Office of Administrative Law if that becomes necessary. The statute that clarified PEI relating to children does contemplate rulemaking at some point, and the probable result would be that you would end up in a rulemaking proceeding long before you want to be. And those of you who remember the last time around probably would want to avoid that. And finally, I want to remind you again that there is a very easy way to comply with this mandate in the Mental Health Services Act by sending PEI money to two programs that are already in the Mental Health Services Act to 5813.5F. One of them is Laura's Law, which is county optional and which is essentially early intervention in the relapse process for severely mentally ill people who have a history of recent violence or dangerousness and who are falling out of treatment. The other program, which has been in the statute since the beginning, it's a broad array of programs, some of which need to be invented, and it's diversion and re-entry programs for severely mentally ill people who are heading into or out of our local jails.
Mary Ann, your 3 minutes are up. Please wrap up.
I will wrap up. I will post the statutory language in the chat box when we finish, but while you could easily comply just with what's in the Mental Health Services Act, I hope you will do better than that. And I know this group has the talent and the ability to create and encourage relapse prevention programs for the severely mentally ill beyond what is already in the Mental Health Services Act. So when you go back to the table on PEI, please remember that is part of your job, and I hope you will do it well. Thank you, and I hope I have access to the chat box to put up the statutory language.
Thank you, Mary Ann. And with that, thank you everyone for your public comments. We are going to move on to item number 1, which is the approval of the November 18th meeting minutes. The commission will consider approval of the minutes from the November 18th, 2021 teleconference meeting. I want to let everyone know that our minutes and recordings will be posted on the commission's website. Staff are paying particular attention to making sure that in the minutes we accurately reflect appropriate pronouns. I would like to thank Pashi Walker for pushing us in this direction. We may continue to make mistakes, but we are being more diligent about this. So in these meetings, there are many things happening at once, and we are working to ensure that we minimize our errors. We do ask for your patience as we continue to get better at this and your assistance to help us get better at this. At this time, members of the public, you may request to make public comment on item 1 by clicking the raise hand button on your computer or the app, or if calling by phone, push *9. Once the public comment period for this agenda item starts, we will close the public comment queue, so please make sure that your request to comment is there now. Commissioners, do you have any questions or comments at this time? Okay, seeing none from my fellow commissioners, are there any public comments?
Yes.
Yes.
Sorry. We do have one public commenter at this moment. Pashi, your line is open. You may go ahead.
Thank you so much. Pashi Walker, pronouns zers, LGBTQ program director at Cal Voices. First of all, Commissioner Madrigal-Weiss, thank you so much for your call out. And I hope that I'm not pushing. I hope what I'm doing is just raising awareness and educating. Don't ever mean to push. I also want to say that I really appreciate the quality of the minutes. So I hope you don't consider this comment too picky, but for my title, the Q was left out. It said LGBT program director. And the only reason I even bring that up is in case someone who does not know me and does not know our agency would think that we are leaving out the queer and questioning populations from our program. So if that could just be corrected, I know that's an easy thing to miss. And I do very much appreciate all the effort that goes into the minutes for this meeting. I know it's not an easy task. Thank you.
Thank you, Pashi, and agreed. Awareness and education is right on, not push. So we will absolutely make that correction. And at this time, we have no additional public comment. As far as I see, is that right, Amariani?
Yes, that's correct. That was the last commenter.
Okay, and also seeing no additional comments or questions from my fellow commissioners, I would ask if I have a motion to correct what was mentioned by Pashi, and if we have a motion to, let me get this right. Do I have a motion to, after we correct those minutes, to staff, help me out. What am I motioning after we make that correction?
You could make the motion to direct staff to correct the minutes, and they will be reflected in the minutes of this meeting.
Yes, that's what I am making a motion for. Do I have a motion?
Motion to approve as corrected.
Thank you. Do I have a
Second.
and thank you. Any additional questions or comments? Seeing none, I would ask that Chief Counsel please take the roll.
All right. Commissioner Bontrager.
Aye.
Thank you. Commissioner Boyd. Commissioner Brown.
Abstain.
The roll. Oh, I'm sorry. For the minutes. Okay, Commissioner Bunch.
Approve.
Commissioner Carnavale.
Yes.
Commissioner Carrillo. Commissioner Chen.
Approve.
Thank you. Commissioner Cortese. Okay. Commissioner Danovich. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Commissioner Rolette.
Aye.
Thank you. Commissioner Tamplin.
Aye.
Thank you. Vice Chair Alvarez.
Approved.
Thank you. Vice Chair Madrigal-Weiss.
Approve.
Thank you. The motion passes.
Thank you. Okay, we are, I'm not going to jinx it. We are moving right along. So let's go with that. All right. Item number 2, Immigrant and Refugee Stakeholder Advocacy Outline and Authority to Award Contracts. So 3 years ago, the Commission sought funding to address the mental health advocacy needs of immigrants and refugees. The legislature approved the request and provided funds to ensure that immigrants and refugees were included among the 7 other populations represented through the advocacy dollars. Today, the Commission will consider approval of an outline of the request for proposals for the next round of immigrant and refugee stakeholder advocacy contracts, and will consider authorizing the staff to enter into contracts with the highest scoring applicants. Members of the public may request to make a public comment now on item number 2 by clicking the raise hand button on your computer or the app, or if calling in by phone, push *9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. We will have a presentation from Tom Orrock, Chief of Stakeholder Engagement and Grants. So Tom, I welcome you to please come forward and present. Thank you.
Thank you, Madam Chair, Vice Chair Alvarez, and Commissioners. Thank you, everybody. In an effort to hear the voice of mental health consumers who are often inadequately served, and to address cultural and language barriers that can create roadblocks sometimes to mental health care for specific populations. The Commission provides funding to organizations who deliver advocacy, training and education, and outreach and engagement on behalf of 8 specific populations. who, as I said, are often underserved or not effectively served due to a lack of workforce who speaks their language, or a workforce who might lack empathy or understanding of their unique struggles. The immigrant refugee community is one of these populations. We can go to the next slide, Cody. Thank you. The other populations are listed here on this slide. The Commission currently has contracts in place which support all of these communities with their advocacy efforts. Today, we're highlighting the immigrant and refugee communities because our current advocacy contracts will be ending on July 30th of this year. And so we're hoping to release the request for proposals to ensure that advocacy efforts continue over the next 3 years into 2025 without any gap in advocacy. We'll go to the next slide. This slide shares a bit of history on the immigrant refugee advocacy contracts. I should say that the Commission was instrumental in creating this opportunity for advocacy. In January of 2018, the Commission directed staff to pursue funding for advocacy on behalf of immigrants and refugees. And as a result, the 2018 state budget provided $670,000 per year to add immigrants and refugees to the list of populations who are underserved or inadequately served in our mental health system. So with that funding, back in 2019, the Commission awarded 5 contracts to local level organizations who had a strong footing in the immigrant refugee communities. In our 2018 outreach and listening sessions, we received feedback that we should fund organizations who have boots on the ground, so to speak, organizations that knew the names of those they represent. We heard that local smaller organizations are often overlooked for funding. And so the funding strategy in 2019 was to award a contract in each of California's 5 mental health regions. So those regions are the far north region called the Superior region, the Central Valley region, Bay Area, Southern California, and Los Angeles. And so we awarded contracts to organizations in each of those regions. And those organizations are listed here on this slide. We go to the next slide. So what they did, these organizations primarily served individuals from Mexico, South America, Asia, Africa, and the Middle East. They met with county leaders, MHSA coordinators, other county behavioral health staff, boards of supervisors, and they met with them to communicate the need for culturally relevant and trauma-informed care. They held roundtable events with community members to increase awareness and comfort level for mental health services. And obviously, most recently, they helped their communities through what was a difficult time during the COVID-19 pandemic. Next slide. What they learned and what we learned as a result of working with them over the past few years. The goal with all of our funding opportunities is to learn as much as we can about the needs of the population, the approaches that are most effective, and the strategies that sustain what works. And so this is the case for our Stakeholder Advocacy Program, as well as our other grant programs such as Mental Health Crisis Response Program and the Student Mental Health Program. So over the past 3 years, we've learned of the need for more culturally aware service providers and peer providers, that peer providers with immigrants and refugees who have that experience and background could really be very helpful. People who speak the language of the populations. We learned that strategies for reducing stigma and providing information and outreach to immigrant and refugee populations is an important task, a task that increases comfort levels and therefore improves access to services. We also learned that the mental health needs of immigrants and refugees are unique, and that they often experience what has been referred to as triple trauma. The trauma experienced in their homeland, followed then by the trauma experienced on their way to the US, and additional trauma brought on by sometimes unnerving and unsettling transition to life here in the United States. These are unique challenges that require an informed and well-prepared mental health system to address. So these funds help to bring this information to mental health providers. We can go to the next slide, Cody. I thought I would highlight the components of the first RFP in 2019 so that you can see where we are recommending some slight changes to this next RFP. In 2019, we funded, as I said, 5 local level organizations, 1 in each of the 5 California geographic regions. They each received $402,500 for 3 years to perform services for advocacy, local level advocacy, training and education, and outreach and engagement. And next slide. So that was the 2019 basic outline. In preparation for this RFP, Commission staff held listening sessions with the larger community. We held a meeting and listening opportunity with the Cultural and Linguistic Competency Committee. And we also spoke with our current immigrant refugee contractors about their experiences with the contract and their work. So this slide shows the 3 common messages that we heard from stakeholders throughout these public outreach events. First, we heard that contracts should be awarded to organizations based in regions with the highest concentration of immigrants and refugees, and not necessarily in California's 5 geographic regions. We also heard that a statewide organization would be a positive addition and could serve to bring the voice of local level organizations to state level leadership. So what we're learning locally in counties or organizations that serve immigrants and refugees locally, that information can be translated to a statewide contractor who could then provide state level advocacy. And we also heard that advocacy, cultural humility, training for providers, peer providers, and also evaluation of program effectiveness are the keys to successful advocacy. So we can go to the next slide. As a result of what we heard, staff is recommending these components be included in the RFPs. This is a very high level outline. And so because this is a competitive process, I'm not able to provide specifics about the requirements. But generally, we are recommending that we release 2 RFPs, 1 to fund 4 local level organizations in regions of the state with the highest concentration of immigrants and refugees. This would be RFP A, and another RFP to fund 1 organization who will provide statewide advocacy and provide support to the 4 local organizations. The contract funding levels are listed here. $402,500 for the local organizations and $400,000 for the state level contractor, and these would be 3-year contracts. The next slide outlines the minimum qualifications. These are the minimum standards or qualifications that we put in place to ensure that the organizations are well established, that they have the capacity to carry out the work, and that they have the necessary experience to be effective in their work. And so the next steps for this, if approved, would be that February 28th, we would release the RFPs to the public, and then April 29th, the proposals would be due to the commission for evaluation. And in May, we would provide or announce an intent to award funds. And then that would allow us time to get under contract with the organizations who are awarded, so that June 30th of 2022, we would have contracts in place so that we wouldn't have any gap in advocacy. And so if approved, the proposed motion is listed on your screen. If we can go to the next slide. The commission approves the proposed outline of a request for proposals for immigrant and refugee stakeholder advocacy contracts to support advocacy, training and education, and outreach and engagement efforts on behalf of immigrant and refugee populations. The commission authorizes the staff to initiate a competitive bid process and enter into contracts with the highest scoring applicants. And I'd be happy to answer any questions that you might have.
Thank you, Tom. At this time, I would ask my fellow commissioners if there are questions or comments to what Tom just provided us. And I see Commissioner Alvarez, please.
Thank you, Chair. I just wanted to follow up on Tom's comments and express our appreciation to the CLCC for the feedback that they provided on this specific RFP, and also to give just a recognition and appreciation to Tom and the OAC team for utilizing our channels of communication to gather valuable input and feedback on the way we roll this RFP out. And the opportunity to serve the unique needs of diverse immigrant communities is new for the commission in these last couple of years, this very targeted effort. And the expertise is in development for our team. And to be able to use the CLCC and members of the public and this valuable communication feedback channels is so important to strengthening this program for the future and ultimately for impact and the people we want to serve. So I just really want to commend Tom and the commission for identifying these channels and for the members of the public and our CLCC for that valuable feedback that enables us to make this proposal as strong as possible. It's obviously not perfect and we'll continue to improve it as we move forward, and we want to make sure we gather valuable information so that we can further inform our processes for the future. But every little effort to make it better by listening to community really reflects our commitment to equity, and I just want to express my appreciation.
Thank you, Commissioner Alvarez. I'm going to go with, I didn't see in which order the hands, but I see it on the top of my screen. So I'm going to go with Commissioner Brown, please.
Thank you, Chair Galvez. Question for Tom, and that is with the requirement that the local community organizations have been established for 2 years, at least 2 years. I understand the the need behind that, and in most instances, in most communities, I think that's probably appropriate. But was there any discussion about modifying that to provide for exceptional circumstances for groups or communities where a need has arisen that has not necessarily been historical, has not been, or where the need is much more significant? I'm speaking particularly, my thought is about the Afghani refugee community that obviously was not really anticipated and was less than 2 years ago. And there's this significant group of people that have come into our country that have needs, and organizations may not have existed that addressed that particular community to the extent that they may need to now. I'm sure that there are organizations that address it, but I just don't know if that would be there. So is there any way that we could modify that to provide for some kind of override, I guess, to that 2-year requirement if a group was had come to the forefront, like in this particular situation, that really had not been a sustained ongoing need necessarily in the country?
Yeah, I would say if I can answer that, yeah, the commission could choose to reduce that time. I mean, if we feel like a year would be more suitable, then that's something that we can certainly do. I hear what you're saying, and there are organizations around the state that do serve Afghan refugees, and obviously have been very busy of late. But yeah, we can do that. Our goal with the minimum qualifications is not to create roadblocks for organizations. So a reduction to 1 year, really, like I said, what we really just want to make sure we do is we contract with organizations that have some track record of some sort. But like you're saying, at the same time,
I certainly get that, and I think in most instances 2 years is probably appropriate. I just wonder if there could be a, you know, some kind of a, or other qualifications, you know, as sometimes you'll see in a job description or something that,
Yeah.
that are extenuating, that basically would make the organization qualified due to exceptional circumstances.
This is Commissioner Mitchell. Regarding the 2 years, I thought that the 2 years was for 2 years of experience delivering these types of services. Is that correct?
Yes, yeah. So we would want the organization to have at least been in existence for that period of time.
Okay, and what you just said is that there are organizations that have that experience that have been in existence to support the Afghani community, correct?
Yes.
Okay.
And so, you know, what we could do is we could potentially add the or there and say, or organizations who have been recently formed to address exceptional circumstances or the recent or the needs of recent arrivals.
Madam Chair, if I might, I'd recommend that we recognize Sheriff Brown's comment, and what we'd like to do is work with you, if that's the commission's pleasure, to tighten this language a little bit to reflect the array of comments rather than go through all of the options, because we want to take them in the context of the comments that we received. But very, very much appreciate Sheriff Brown's comments to make sure that we have organizations that could be responsive to the needs of sort of recently developing needs, in the example of Afghan refugees. So rather than explore all the options, what we'd love to do, if that's the commission's wish, is just to either work directly with Sheriff Brown or with you as the chair to tighten the language before it is released. I'll note that there's also a provision in the process for us to modify that language if, for example, along the way, if, for example, there are an insufficient number of applicants for the RFP. Thank you.
Yes, thank you, Toby. Yes, appreciate that. I have Commissioner Rolette, Commissioner Gordon, Carnevale, and then Commissioner Templin. So please, Commissioner Rolette.
Thank you very much. I wanted to acknowledge the comments of the chair of the CLCC. That was my first question, and it was answered. So thank you regarding their involvement. The second thing that would be helpful for me in making a more informed decision is to understand what stakeholders or what the stakeholder process was like, and what stakeholders had input into the process of developing the RFP. And again, as this is my second commission meeting, I recognize that some of that might be satisfied by participating on a committee, or it could be satisfied by listing it in the PowerPoint and demonstrating that these were the organizations that or groups or individuals that had input into development of the RFP. That helped me in terms of voting and going forward. Thank you.
Thank you. Commissioner Gordon.
Thank you, Chair. I also wanted to raise the issue of the Afghani refugees. And I wonder, I have heard that these contracts have been very, very effective in the places they've been operating, but we're not even close to covering all of the state with the contracts. And I'm worried, particularly with the Afghani population in Sacramento. It's not a newly arrived population. It's been around for quite a number of years. And there are service agencies which are well established And now the need is exacerbated by the fall of the country and a lot of people getting stranded there and trying to escape. So the need is even more acute. And I'm just worried that if all we do is make people compete for limited money when the services we're putting out right now are very effective, I wonder if there's any opportunity to add some dollars so that we can open up more contracts to serve these emerging needs as well. So that's my question.
Yes, I think it would be excellent if we could add additional funding. There is definitely a significant need around the state. We have several regions where there are high concentrations of immigrants and refugees, and this funding is excellent as a start, but it would be really helpful to have additional funds, especially since in the last couple of years we have seen an influx of new arrivals, refugees who are escaping persecution or difficult situations. And so I think that would be helpful, and it would be welcome to have additional funds. And I wanted to comment too on Commissioner Rolette, what you had to say. I think that's excellent feedback, and I appreciate it. I think when we do listening sessions and public outreach, obviously it would be helpful to have a list of individuals and the organizations that they represent. And so we tried to do that with our current contractors, with those organizations listed who are currently providing the services. And then within our Cultural and Linguistic Competency Committee structure, and those members represent several different organizations around the state. But yes, thank you for the feedback. And I think in the future, we'll list those organizations so you can have some assurance that we have heard from a good, varied group of organizations.
And Tom, I just wanted to clarify in my comment that my hope would be we could find some way to add some dollars to this current procurement, because this need is immediate. And I think one of the advantages the commission has is it tends to be more nimble than the typical processes. So I think if we could find a way that would be very helpful.
Yes. Yeah, so, one of the things we hope for is we hope that there will be a significant number of proposals that are sent in to us. We always like to see a good level of interest. And so I think if that's the case, we probably need to do a good job of communicating that to the legislature to let them know that, because many times that reflects the need. And I think that was the case with our Mental Health Student Services Act funding. There was such a response to that it reflected a significant need.
Thank you, Commissioner Gordon. Commissioner Rolette, I'm sorry, I moved right on to Commissioner Gordon, and after Tom responded, was there anything else you wanted to follow up with Tom after his comment?
I acknowledge that, and thank you very much, Tom. I think it, again, accomplishes what you articulated, and I think that it demonstrates to everyone the importance of including the perspective of other stakeholders and who they are and their input into the development of the RFP. Thank you.
Thank you. Commissioner Carnevale, please.
Thank you. I certainly support the general objectives of the program. I'm wondering if there is any data that exists on the effectiveness of these programs, both in terms of the effectiveness of the advocacy and the results of the advocacy of what happens to help these individuals and families. And is there a requirement to do so in these contracts?
Yes, and it's really one of the reasons that we're hoping to bring on and provide funding for a state level organization who can assist with an evaluation. We always say that advocacy is difficult to measure because many different organizations weigh in on bills that may be out there that would support immigrants or refugees or other populations. Typically, what has been measured in the past is the number of events, the number of roundtables in this case, who we spoke to, and what that may have led to locally. But we see it as a need, and it's acknowledged in this outline that a state level organization could assist with that. And also the commission staff, our own internal research and evaluation team has been helpful with that in the past. And it's just something that we'll need to continue for these contracts as well. But it's acknowledged, and it's something that we need to record and set up the specific measures that'll tell us about the effectiveness of the programs.
Thank you, Tom. I think that's great to hear generally. I guess I would recommend putting the onus on the people who deliver these contracts to deliver some basic metrics. I mean, I think both about effectiveness and efficiency and return on the investment. If you're tracking, for example, how many people you reach per dollar invested in a program, that helps you to identify, who's being more effective than others. That helps you share best practices. There's a lot that can be learned, and if we can drive the system to serve more people within the dollars that we have, then we've accomplished our mission at a greater level. So I think we should be including some requirements to deliver a list of metrics that they can report on, and to the extent they can, there are in business, there are a lot of tools now available to be able to measure what happens when somebody touches a company, and we should be employing those latest practices for these kind of organizations as well. Thank you very much.
Yeah, our current contractors, with all of our stakeholder work, they're capturing, the qualitative and quantitative data in terms of how many people they're interacting with, or how many people they've trained, how many they've provided outreach and advocacy to. So we have counts of that, and that that is a typical requirement of these programs. But I guess what we need to learn more about is what it leads to, what that contact has led to, and so really looking forward to that kind of help. I think a statewide organization could assist with that, who may have more experience with data collection than some of our local level organizations. So thank you.
Thank you.
Commissioner Tamplin, please.
Thank you. This is such an important RFP and a long process in getting here. And I'm very grateful to see the state funding too. I am in support of Commissioner Gordon's advocacy for additional funding for all throughout the grantees and categories, regional categories, and because I think, like many have said, the needs are extremely high for our immigrant and refugee communities in trying to navigate our public mental health system and address the stigma around mental health in talking about it, not necessarily about treatment, because sometimes our communities actually have community approaches that are effective than necessarily like what we think the clinical approaches are in terms of helping people in crisis in these areas. But I also wanted to assure Commissioner Brown that there is a lot of, there are quite a few agencies throughout California that have been serving the recently arrived Afghans and the ones that have arrived like 40 years ago, like my family did when I was 3. So I appreciate the attention to the years of experience. I think 1 or 2 years, it's not, I just want to say we do have throughout California, the Los Angeles region, the Bay Area region, the Sacramento region have been serving the Afghan population. But I think the funding for all of the regions that we're looking at to serve the multiple communities that are here as immigrants and refugees is definitely a great idea to increase. I want to share that piece. Thank you.
Chair Madrigal-Weiss, if I could just jump into what I didn't articulate. I'm aware that there are some very good organizations helping this community, particularly in the Bay Area and in Sacramento. But I know that because of the large influx of refugees, there are refugees in other areas now that are not as established and perhaps don't have the resources as well. And if someone was to propose a project for this population or any other population that was to come in the future on an emergent basis like this, I just was concerned that they might not have the bandwidth or might not have the experience or the 2 years of establishment or employees that had worked for them for a year because they haven't, maybe are just getting started. So I think that, there needs to just be some way, if that occurs, and if that need is there for us to be able to recognize that may not fit into the traditional method of evaluating an organization that we typically have used, just because of the tremendous influx of people that have come in as a result of the fall of Afghanistan.
Thank you, Commissioner Brown. Seeing no other comments from my fellow commissioners, we will move on to public comments. So I will ask you to please raise your hand now as the queue will be closing. And this is a reminder that members of the public should be prepared to complete their comments within 3 minutes or less. Please note that the meeting moderator will unmute your line and announce your name or the last 3 digits of your telephone number. Once unmuted, we can hear you. So I'm going to ask Amarani, please open the line for public comment on agenda item number 2.
Okay, Stacy, your line is open. You may go ahead.
Good morning, Commissioners. Stacy Hiramoto for REMCO, the Racial and Ethnic Mental Health Disparities Coalition. First, I want to thank Tom Orrock and the Commission staff and Commissioners so much for having a better process of listening to stakeholders for this grant. I can assure Commissioner Rolette that for this particular RFP, they did a better job, a much better job than the first time around of listening. I particularly want to commend you for having a component for state level advocacy. I have, since the last RFP, I have spoken to refugee and immigrant agencies who have told me, of course, there are a tremendous number of issues at the state level that could be addressed that would help refugees and immigrants across the state, not just in particular communities. So again, thank you so much for having a state level component. The second point I have is not at all a criticism, but it is to try to help you. I think that the commission should go ahead and decide whether or not you would like certain populations to be reached. I think it's wonderful that you want to divide it into 4 geographic locations, but do you also want to divide it into certain populations? Just let me give you an example, and I'll use my own community as an example. If you are just going by who writes the best RFPs, and you like 3 out of the 4 local grants are going to Asian organizations and none go to the Latino community, I'm telling you, you're going to have a lot of people at your commission very upset. So I think it might behoove the commission to think a little bit more about, or vice versa, right? And so I think you might want to think about having separate categories, again, just so it's clear, because if you just go, well, we're just going to take who's ever the highest scores, or you may want to let people know we are going to spread these out among different geographic areas and different populations. So then that way you also will not get a complaint if somebody has a really high, score on their proposal and then you don't pick them. And again, I'm trying to help and I'm trying to support you because again, I appreciate the work. The third thing is I really think the commission should think a little bit about this grant is for, at least traditionally, these have been advocacy grants. Now, are you talking about advocacy on behalf of these communities, or are you talking about teaching these communities to advocate? Because again, as far as refugee and immigrant communities, the need, yes, the need for them to get basic things like food and shelter, it is so great that you might say, well, wait, we can't teach them how to do advocacy because we have to tell them first, how to survive. Well, I get that, but on the other hand, as people have said, there are organizations that are in existence that have served refugee and immigrant communities. And if they could teach some of these communities that have been here to advocate on behalf of themselves, again, it's the whole, are you just going to give them fish or teach them how to fish? And I'm not, again, trying to criticize. I just think it should be more clear. And again, I do want to thank the commission so much for all the work. And I think you're on a great track. Thank you very much. And I'm very happy to help if I can help in any, Remco can help in any way. Thank you.
Thank you, Stacey.
Okay, Pashi, your line is open. You may go ahead.
Thank you so much. Again, Pashi Walker, pronouns theirs with Cal Voices. So I want to first speak to the evaluation component that's in the outline. I have a few concerns regarding how this could be viewed. It states that evaluation can include workforce development, growth of trained clinicians, and increase of community-defined and affirming mental health practices. And while these are admirable outcomes, these examples are either going to be very difficult to measure and or are very long-term goals that most likely cannot be accomplished within 3 years. Having worked in LGBTQ advocacy around these very same issues, it can take a long time to get a local county, let alone a region, to change these practices in a way that's absolutely measurable. It's also not clear from the outline whether this would be a third-party evaluator that the each individual contractor would have to pay out of their money, or are you asking them on top of everything else to evaluate, to learn how to do evaluation themselves? And I would also like to suggest that maybe evaluation of whether or not the contractor met their scope of work is important, but the evaluation of whether changes occurred within the system, while it would be helpful, it might be more useful as a guide as to what areas are local focused advocacy efforts able to achieve a local system change, and or what type of local focused advocacy works best to foster change, and what systems change at the local level requires more support instead from state level advocacy. So where should we be focusing our efforts? I also have a couple of concerns about the statewide contractor outline. There's a bullet that says that they will be supporting the 4 local contractors and 1 additional organization, but I don't see any mention of who or what that additional organization would be and where funding for that additional organization is going to come from. So commissioners might want to ask about that. It also says that they should be registered to work in California, but there is no requirement that they be a California-based agency. And it just opens the door for an out-of-state agency to hop in and say, look, we have an office here. That's very different than being a homegrown agency. And so I would just really strongly advocate that they be a California base, their home office be here, not just be registered to work here. And finally, Out for Mental Health in the Cycle 1, Year 3 State of the Community Report did some some really detailed work on LGBTQ refugees and immigrants. And I would like to request that the RFP include that there be a focus for each population specifically on their LGBTQ immigrants, refugees, whoever they're working with, because not only do they face the same disparities, but they often have faced increased trauma in their home country and amongst their fellow refugees and immigrants, so that they are the most isolated and have oftentimes the worst disparities of everyone within that population. So please make sure that they're included and that their needs are addressed. Thank you so very much.
Thank you, Pashi.
Hannah, your line is open. You may go ahead.
Good morning, commissioners. My name is Hannah Bickoff, Policy Director at Cal Voices. I wanted to start off by commending the Commission in their work to support the immigrant and refugee communities. This is incredibly important and timely work, and I'd also like to thank Mr. Orrock for his very thoughtful presentation. I wanted to also echo the comments made by Commissioner Brown and others and thank him for identifying the need to make exceptions to support newer organizations that are rising up to meet the emerging needs of populations who are working with newcomer populations, such as Afghan refugees. In Sacramento alone, where more Afghans are resettled than anywhere else in the country, there are multiple new and historic, well-established organizations doing this work. Secondly, I wanted to briefly comment on an important element of immigrant and refugee advocacy work that I believe was voiced in some of the listening sessions, but I noticed was not represented in the final report. With the constantly shifting federal policies shaping opportunities for immigrants and refugees to apply for legal status, it is critical that these contracts also specifically honor organizations that incorporate advocacy for legal supports. We know that citizenship is a strong factor in impacting an individual's mental health and a well-known social determinant of health. I hope that we can continuously expand the way we understand mental health and the various barriers that individuals face who are undocumented and in need of legal services. For that reason, advocacy efforts should expand beyond the traditional ways in which we define mental health and also include the right to other supports, including access to legal services. Thank you so much for your time.
Thank you.
Sharon, your line is open. You may go ahead.
Okay. Hi, I'm Sharon Yates. I'm a committee member for the CFLC committee. As we move forward with this RFP, I'd like to request that you have a child component as part of the process. Many times when immigrants come over, they bring their children with them and the children are just traumatized. This can be the beginning of our school mental health program that we've often talked about, but have not quite implemented yet. Perhaps we can build a foundation so that as these children come into our country and get acclimated to becoming citizens and becoming part of our society and going to our schools, we can mitigate any kind of problems that they may have. So I would like to request that we implement a child component to the immigrant and refugee program. Thank you.
Thank you, Sharon.
Okay, and our last public comment, Gulshan, your line is open. You may go ahead.
Good morning. Can you hear me?
Yes, we can.
Okay. Thank you. Just having a little internet issues. Good morning, commissioners. My name is Gulshan Yusufzai. I'm the executive director with MASS SSF, which is a nonprofit that has provided wellness and mental health services specifically focused on peer support for the last 14 years. And we actually have a project for the last 5 years that focuses on a community-defined practice geared towards the Afghan community. And we've, as a result of that, recruited and trained over 68 peer specialists from these communities. I just want to go ahead and just wanted to acknowledge and thank the Commission for bringing up this topic and focusing on this, and specifically the comments made by Commissioner Brown, Gordon, and Templin in terms of the comments that were made. As an Afghan refugee myself, and given that this has been a problem since '79, and there are high numbers of Afghans in Sacramento since then, and then again in 2014, and again now, there are a high number of challenges that have existed and are going to continue, especially with the recent Afghan crisis. So I just wanted to thank you all for bringing attention to this. And certainly I think the amount that is being suggested in here is, it would be greatly appreciated if that could be increased, especially this time around with the number of refugees that are coming through because of the crisis and the challenges that they're having. And also because of the as you might be aware, there's 70,000 that are in the military bases and 8 counties that are impacted, with Sacramento being the highest county. But I also wanted to point out the needs of the LGBT community. This is a big problem in the Afghan community and always has been. And although it's not acknowledged, as Pashi had said, it is something that that is going to come into hopefully into acknowledgement as the community resettles here, as they're dealing with adapting to a new life. So I want to also, acknowledge that, and this is extremely important area that that needs to be addressed, given the 40 years of war, but also because the LGBT topic is a huge issue, but it's something that has not been focused on. But it is time that we do that, because we at MASF generally get lots of cases with situations such as the one I just described. Thank you again for your support and for the input process that has been put in place to allow not local and community members to be able to be involved. Thank you.
Thank you, Gulshan. At this time, we want to propose the motion, and then we will, I need a motion. Help me out here, please.
Cody, can you bring up the motion on the, should we bring the motion up on the slide?
Yes, please.
Thank you.
All right. So here's our proposed motion.
Okay.
And I will ask for a motion and a second, and then we still can have additional questions or comments from our commissioners. So at this time, I would ask for a motion.
I move that the commission approve the proposed outline of requests for proposals for immigrant and refugee stakeholder advocacy contracts, etc.
I'd like to second it.
Thank you. And at this time, I would ask for any additional questions or comments from our commissioners.
Chair, can I just, maybe I should have said this as part of my proposed motion. Following up on Toby's comments, but also an acknowledgement of Commissioner Brown and others, can we approve the proposed outline and commit to further discussion to reflect this morning's conversation before the release of that competitive bid? Is that general enough to capture the very important conversation that we just had?
I think it is. And Toby, I would ask that you share with us how we can do that, how we can strengthen this and incorporate those comments that have been shared in the conversation that was reflected today.
Thank you. Appreciate that. So part of the challenge here is that because this is a competitive procurement, we typically only speak at a very high level about the details in the procurement so that it doesn't create an unlevel playing field for organizations that may want to apply for these funds. We've certainly taken notes, and so we do not present the actual RFP to the commission publicly until it is publicly released in order to make sure we're following procurement rules. There are provisions for us to modify that through the procurement process as there's a period of sort of comment and engagement where organizations that are interested in the procurement raise questions. our procedures require us to respond to those questions in a way that is publicly disseminated so that all potential applicants have the same information at the same time. So there are some ways that we can modify along the way to still follow the procurement rules. What I would ask is if the commission would like to have some further detailed engagement, is that you designate a member of the commission who can, so to speak, stand behind the curtain with staff to address these issues so that we don't violate either Bagley-Keene issues about public meetings and quorums or the competitive procurement rules that require us to keep certain information confidential until it is publicly released. If we could delay this, the challenge is there's some urgency to get the funding out quickly, and it typically takes us about 5 months to do a competitive procurement, do the awareness work, the outreach and appeals process. So you certainly have the option of holding this over and doing it again next month. A faster way would be to designate a representative of the commission who could ensure that staff has been responsive to all the comments that you've identified.
Thank you. I wouldn't want to hold us back. The need is there. So I would want to move quickly on this. And I think the way would be to designate. Before designating, I would want to ask of my fellow commissioners if there would be a volunteer who I could designate. Who would want to volunteer first before I would, to be that person behind the curtain?
I'd be willing to volunteer.
Thank you, Commissioner Carnevale. So Toby, having Commissioner Carnevale volunteer to be designated, we designate Commissioner Carnevale to that role.
That's right. So move forward with the proposed motion, right? Sort of the addendum would be Commission authorizes staff to work with Commissioner Carnevale to initiate a competitive bid process consistent with the comments today and the outline that you've received. I also will note that you may want to take a separate motion to ask staff to engage the administration, the legislature to increase the funding level, which is also part of the conversation. I think many of the public comments are reflective of the fact that there's just not enough funding. At $400,000 a contract, per year. So what I think the total is, actually, no, that's over 3 years. There's just not enough money to partner with an academic institution to do all the research. That doesn't mean that data collection isn't possible. It just, there's a lot of capacity building that we're trying to do. These needs are just tremendous, as everybody has outlined. So you might, as a second issue, bring that up as well.
Yes. So how do we do that, Toby, then? We would take.
Well, I would move forward with the motion you have in front with the direction that we work with Commissioner Carnevale to address the comments to the extent that we can.
Yes.
And move forward with that motion.
So do we have the motion to do that then? Is that a new count? So we had Commissioner Alvarez.
Can I amend the motion?
Yeah, so the way this should work is the commissioner who made the motion accepts that amendment, and the commissioner who seconded the motion accepts that amendment. And so it is a modified motion. It's the motion on the screen in front of you that Commissioner Alvarez mentioned in her original motion, with the amendment that staff would work with Commissioner Carnevale to address the concerns raised today.
Thank you. Commissioner Alvarez, do you accept that amendment?
I do.
Thank you. And then Commissioner, who's second? I'm sorry, I lost.
I'm second.
Thank you, Commissioner Mitchell. You accept that amendment?
Mm-hmm.
Thank you.
Yes.
And with that, we take roll?
Correct.
Correct.
Thank you. Maureen, please.
All right. Commissioner Bontrager.
Aye.
As amended. Thank you. Commissioner Boyd, Commissioner Brown.
Aye.
Thank you. Commissioner Bunch,
Aye.
Commissioner Carnavale.
Yes.
Thank you. Commissioner Curio, Commissioner Chen.
Approve.
Thank you. Commissioner Cortese, Commissioner Danovich, Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Aye.
Thank you. Commissioner Tamplin.
Aye.
Thank you. Vice Chair Alvarez. Okay. And Chair Madrigal-Weiss.
Approve.
All right. The motion passes as amended.
Thank you, Maureen. At this time then, with the discussions that we would want to advocate for additional funding, how would we make, please, Toby?
Oh.
Go ahead.
Well, I would recommend that pause on that and bring that up under the next item because it is legislative priorities. And that's a cleaner opportunity, and it will allow us to have more focused public comment on that issue, because I recognize that the public comment, although it touched upon this issue somewhat, that's a, I think the agenda would allow the conversation in either item 2 or item 3, but given where we are in the agenda, given the focus of item 3, it's probably a safer opportunity to have that conversation under item 3.
Great. Thank you so much. Yes. Okay. So the motion passes.
Yes.
Forgot to say that. All right. Moving on. Thank you so much. We are now moving on to item 3, the legislative priorities for 2022. So moving to item 3, the commission will consider approval of legislative and budget priorities for the current legislative session. We have some new commissioners, but many of you will recall that the commission has prioritized an active role in policy conversations related to mental health policy. On occasion, the commission is asked to provide support on bills, and we have sponsored and supported legislation for the past few years. The legislative session is starting, and our agenda today provides an opportunity to discuss legislative priorities. We have 2 items listed in the packet for discussion, and I will raise a 3rd item for consideration. Here's how I would like to do this. First, we will hear from Travis Legault, and I hope I'm pronouncing that correctly, Travis. If not, when you're up speaking, you will let me know how to pronounce it. He is a staff member to Assemblymember Carrillo on her bill AB 748. We will then hear a presentation from Deputy Director Norma Pate on SB 82 and the potential for some reforms, along with a report out regarding other legislation we have been tracking. And then I will promote an opportunity to support a 3rd item. At that time, I will welcome any of my fellow commissioners to raise additional issues for consideration. We will take public comment after all proposals have been presented. This approach will allow us to see the range of proposals up for consideration and to hear public comment on the individual items as well as their collective impact. Then I will ask council to lead us through a vote on each item separately. This may get a little confusing, so trying this out. So I will rely on staff to make sure we stay on track like you've seen I've already done. I thank you in advance for your patience. We're working through this new way, and we'll see how it works out. So with that, let's get started. At this time, I would like to welcome Travis Legault, staff member to Assemblymember Carrillo, as well as Catherine Chu, a student who is joining him on this presentation to share with us the goals of AB 748. So Travis and Catherine, I welcome you. Your mic should be open. Thank you so much for being here and sharing your thoughts and plans around AB 748. Welcome.
Yeah, thank you so much. And you did say my last name right. Good morning, everyone. My name is Travis Legault, and I'm a legislative aide for Assemblymember Wendy Carrillo, who represents the 51st Assembly District in Los Angeles, and is also proud to be a member of this commission. I'm glad to be here this morning on behalf of the Assembly member to learn more about the bills that the commission is supporting to address our state's mental health needs, but also to ask you to support the Assembly member's bill AB 748. And this bill will require California's middle and high schools to display a poster making information available to students about common mental health symptoms, positive coping strategies, and school site mental health resources available to them. Even before the pandemic, the California Healthy Kids Survey that comes out every 2 years from the Department of Education and the Department of Healthcare Services noted that there's been an increase in depression, anxiety, and other adverse mental health symptoms among our middle and high school students beginning in 2015. And those surveys also note that students of color are more likely to be affected. This year, we're going to receive the results of the first California Healthy Kids Survey conducted since 2019, and the results are sure to be troubling. As students come back to campus, now is the time to offer meaningful interventions and help those that need it get back on track, and making sure our students are aware of what to look out for and how to advocate for themselves to seek help is really key, and that's what this bill seeks to do. The bill has no opposition and has gone through 2 committees in the Assembly with unanimous bipartisan support. The Assemblywoman would like to give a special thank you to the sponsors of this bill, the California Association of Student Councils, and we're really happy to have Catherine Sue with us from that organization today to talk a bit about the bill as well. But I just want to thank you for your time this morning, and I hope we can count on the commission to join our coalition of support to make a positive change for our students across the state.
Thank you, Travis.
Yeah, thank you, Travis. And I just wanted to also just build off on what Travis said about AB 748 and share a little bit of my story and why CAS decided to sponsor this bill. So my name is Catherine Shu, and I'm currently a senior at Westlake High School in the Conejo Valley Unified School District. I'm here today representing the California Association of Student Councils as our Governmental Affairs Policy Director to demonstrate our support in sponsoring this bill. So to briefly reiterate the following bill, AB 748, it requires school sites to display posters regarding mental health resources for students between grades 7 through 12, so middle and high school students. And as one of many students who have struggled to navigate the COVID-19 pandemic and the return to in-person learning, I've continued to struggle with my own mental health. And there had been moments where I felt very lost and like challenged and very anxious throughout the pandemic. And they came with like great consequences with a lot of lack of motivation. And that affected me for like a long term when I was going through like being on Zoom every single day and having to turn on my camera. And I believe like a lot of students in California have faced similar issues and similar experiences. And I don't think that we fully like know the extent of how the pandemic has affected like our mental health, but based on like what I've heard among like a lot of students I've talked to and like my personal experiences, I do know that our performance in school has been affected, and many of my peers have been like deeply affected in education due to mental health issues exacerbated by the pandemic. And then according to the National Alliance on Mental Illness, all youth in the US, 16.5% of ages between 6 to 17 experienced a mental health disorder in 2016. So that's around 7.7 million people. So these staggering numbers like depict the rampant issue of declining mental health and how much it affects youth and the extent of how many youth it affects. So by implementing posters that contain resources for youth, these posters will encourage and provide an opportunity for me and so many other students to have an ability to find help and to seek help. And I think right now, a lot of my peers like don't really have easy access to these resources, or they're not aware of these resources. And even though we may have like great things like wellness rooms or like counselors or people to support us, if we don't know about it, then it's not really helpful. So having these posters could really like make it personalized for each school district or for each school to be able to get to know more about like each school's like support resources for the students. And then I also just wanted to thank Assemblymember Correa for championing this bill. And thank you for your time and consideration. I urge your support for this bill. Thank you.
Thank you, Travis. Thank you, Catherine. At this time, I would ask if there are any of my fellow commissioners have questions or comments.
Hi, Chair Madrigal-Weiss. I have a question, a comment and a question. Thank you very much for the opportunity to discuss this legislation. Public education and awareness is such an important component of ensuring we're building awareness around these very tragic numbers and the reality that our young people are facing. So thank you very much. I do have a question about like the development of this poster and the distribution. Are these resources intended to create a process that will allow this poster to be youth informed, for example, and then making sure that we have the resources to distribute it to every school, given that schools may not have the resources to print them or to make them available in their local community? That's one question. And then my other question is, there are some counties who have done this, right? Who have put a large amount of resources into public education campaigns. I'm thinking, the Why We Rise campaign in Los Angeles County. So I'm curious how we expect to leverage those opportunities, and in particular, any lessons learned, right? Like, did it make a difference to have this investment in public education? What can we do better in rolling this out? So just curious your thoughts on that.
Yeah, Commissioner Alvarez, I'd be happy to take that. There's some pieces there that I'll have to look into a bit more and follow up with you on. But as far as how the poster would be crafted, there are some options for the district. The bill does direct CDE to create a model poster, but it's really open-ended as far as how districts want to go about creating this resource. And then those other pieces on implementation, I'll follow up with you on.
I also just wanted to briefly add, so kind of the way this bill or like this bill like posters idea was created was it's modeled after another bill that was signed into law a couple years ago that put like sexual harassment like posters around schools. And basically it spread awareness of like resources that you can seek if you have been like sexually harassed. And I see them around my campus, and I talk to a lot of students, and they find them really helpful, and they didn't know about like the policies in place. So similarly, like this bill and these posters would help like educate students and help spread awareness.
So are the resources on the posters are specific to the schools, or are they local resources or state resources? Because I just know there's a vast variety in the resources that different schools have available. And even at my kid's school, it's K-8. So, what the elementary school sees and what they have available is very different than even the middle school, despite the fact that it's on the same campus. And I think I'm more concerned about the schools that, and sadly, there are schools that have no resources available for their students on campus.
Commissioner, thank you for that. Yeah, the bill is currently written, would just have schools directing folks to school site resources, but that's definitely something we'll take a look at, and thank you for that feedback.
If I could just add as well, I think a couple of things, I think based on what my fellow commissioners Bunch and Alvarez said, it's important. First I was thinking posters, so many of our students have digital access, but I think it's really both. It's not, either or, it's really an and. There are students that don't have access to digital resources, so I can understand the poster. And if you had a poster that also has things like a QR code to it, to additional resources, that would be great. I think local resources are fantastic. I think warm lines, if they could have access to warm lines or text lines, those kinds of things. I think that's important. I think whatever, and, as Commissioner Bunch talked about, if it's local, that's important, but if whatever we put out there, I think it's important that we ensure that we have youth voice in the decision-making. So we have all this opportunity for youth voice. And one thing is to have the voice, and then we need to follow through with the listening. And I think that's where we fall short. So we have invitations for the youth voice, but they really need to be shaping this. So I would suggest that if moving forward, that we really work with the CDE to, as they're shaping it, because we're asking for the CDE to be involved, but as they're shaping it, to ensure that they're including these things that we've talked about, right? That they have the youth voice, that they get to shape what these resources look like, and that we're taking all those things into consideration. If you don't have strong local supports, then do you have those statewide supports and even national supports? And then also considering, what does the community look like? Do we have resources that are culturally relevant? So are you including that in your language, or is it just standard blanket? So I would like to see moving forward that, Toby, if we also have staff, even our staff, that as we're working with this, that we ensure that those communications are happening with the CDE, just for context around this. So talking.
We would be happy to support the Assembly member efforts to engage with CDE and others to address some of those issues.
Excellent, thank you.
Oh,
Any other? Yes, please, Commissioner Mitchell.
I actually love the idea, because posters, I think, are very powerful on school campuses. And so one of my questions is, because it says here the bill directs the department to develop a model poster. So are we talking a poster that's going to be developed, just one poster? Or are we talking every school district having the ability to create their own poster? I love the idea of youth being involved, because I see a real opportunity here to have a mega awareness by having the students even compete to create the poster, and with information such as a 1-800 number for
Commissioner Mitchell, you're freezing up on.
It says 6 through 12. Oh, okay. Well, I'm sorry about that. But
That's okay.
I just
You're back on
totally
now.
support the idea. Yeah, I totally love the idea of a poster larger than 17 or 24. See it as so powerful at the entrance of a school or in the main commons of a school. Just having the students create it and put the faces on it that to them. So I totally support this idea, and I absolutely love it. So thank you for Assemblyman Carollo's office leading this. I absolutely love it.
Thank you, Commissioner Mitchell. Commissioner Danovich and then Commissioner Gordon, please. Did we lose Commissioner Danovich?
Okay, there we go. I was just announcing that I had joined and needed to be added as co-host, so thank you.
Please go ahead. Let's go with Commissioner Gordon, then we'll bring back Commissioner Danovich. Commissioner Gordon, please.
Thank you, Chair. I was just going to speak in response to Commissioner Mitchell's question. Typically with these sorts of things, the State Department of Education will put out a model policy, which is just that. It's not a mandate to use our policy. It's just a sample which they can work off of. But I think your idea of involving youth in both talking about the content of the poster and also creating the poster is a great opportunity for the districts. And a poster may seem somehow hokey to people, but in a school site, it's a big deal. the posters in the school site really get a lot of attention. And I think the more we get our young people involved in creating and crafting the posters, they become advocates for passing on the information and addressing the issues. So I think this is terrific.
Thank you so much, Commissioner Gordon. And with that, I see no other hands raised from my fellow commissioners.
Sorry, Chair, just one quick thought is,
yes.
And this is to Commissioner Gordon and your leadership is, just how much alignment there is with our school mental health report and the spirit of that report and its goals. So just really I'm looking forward to the opportunity to work with Assemblymember Carrillo's office in maximizing the opportunity.
Yes, and I think that's something we can definitely work together with the State Department of Education on as well. They have been very, very active in this area, and we look forward to working. I would look forward to working with them.
Absolutely. Thank you so much, commissioners. So with that, remember, please, we will be taking public comment after all the presentations and yet before we vote. So Travis, Catherine, thank you for joining us today. We appreciate you prioritizing school mental health. And Catherine, I particularly want to thank you for speaking up on this proposal. It is important that we create opportunities for youth leaders to share their voices and vision, and equally important that we listen to your vision and your voice. So thank you for spending time with us today. We heard you. So with that, have a wonderful rest of your day, and we will continue to move forward. Next, we have the opportunity to discuss the need to modify the Mental Health Wellness Act that we call triage. As you know, the Mental Health Wellness Act authorizes the Commission to provide funding to counties to support an array of crisis services. In October, we heard from Veronica Kelly on behalf of the California Behavioral Health Directors Association that the structure of the triage program is not aligned with the most pressing needs of our community mental health system. Norma Pate will walk us through this opportunity to strengthen the triage program. Ms. Pate also will provide an update on the legislation the Commission supported last year. So at this time, Norma, I will ask you to come forward, and you are on.
Great, thank you, Chair. The Commission's budget includes an ongoing $20 million a year to support the SB 82 Mental Health Wellness Act. The Commission makes these grants available to county behavioral health departments to build out the continuum of care to reduce unnecessary hospitalization and to reduce law enforcement involvement. Funding is used to hire staff for crisis services. In prior years, the Commission prioritized half of the funds for children and the other half for transition-age youth and adults to fill gaps in the continuum of care and to incentivize partnerships between counties and schools. As the Chair mentioned at the October Commission meeting, the Commission heard from subject matter experts about opportunities for the SB 82 triage grant funding and how the Commission can be as impactful as possible with these limited resources. The Commission heard testimony from Dr. Kelly from the California Behavioral Health Directors Association on how the SB 82 funds are essential for many counties to build out their crisis continuum and prepare counties for the upcoming shift in crisis response at the national and state levels. Dr. Kelly also testified that some counties have collaborative relationships with their community partners, while others do not. Dr. Kelly emphasized the importance of working together to create change. Dr. Kelly testified that it would be helpful for counties to be able to use these funds to enhance and expand their existing programs and services, and that there is a need for long-term funding for sustainability. In prior funding rounds, counties have struggled to fully spend the available resources because of the requirement to use funding to hire limited term personnel. Counties often face difficulties hiring staff with short-term grant dollars, and thus funds may need to be returned. It is also important to create opportunities for small counties to be able to use SB 82 funds. Small counties often do not have the capacity to apply for competitive grants to address unmet mental health needs in their communities. As the Commission explores how best to allocate the next round of SB 82 triage funds, the Commission may wish to explore opportunities to strengthen the SB 82 triage grant program so that funding will be aligned with the community mental health needs, including opportunities to better understand and address disparities with the use of these funds. Next slide, please. This is the second year of a 2-year legislative session, and last year the Commission supported Assemblymember Carrillo's bill to create a mental health board at the local level to better understand the mental health challenges youth face in the communities and determine opportunities for improvement. The Commission also supported Senator Glazer's bill that would require the Commission to create a comprehensive tracking program for county spending on mental health and behavioral health programs and services. AB 573 and SB 749 will not move forward this year, and there will be no further action taken on these two bills. Next slide, please. To further strengthen the Commission's goal to promote school mental health as a prime opportunity to reach and serve at-risk children and families in neighborhoods, last year the Commission supported Senator Portantino's two bills, SB 14, that directs school absences due to mental health issues will be treated the same as absences due to physical health issues, and SB 224, which requires all students in California to receive age-appropriate mental health education. Both bills were approved by the legislature and signed by the governor. Next slide, please. The Commission also supported Senator Eggman's bill that directs the Commission to report outcomes for people receiving community mental health services under a full service partnership model and develop recommendations to strengthen the use of FSPs. And Assemblymember Quirk Silva's bill that expanded the authority to use Mental Health Services Act prevention and early intervention funding to support substance abuse needs. Both bills were approved by the legislature and signed by the governor. That concludes my presentation, and I'm happy to answer any questions you may have before I present you with a motion to consider to modify the language in SB 82.
Thank you, Norma. So at this time, I welcome any of my commissioners to please, any of my fellow commissioners, if you have any questions or comments, please. See none. Miss Pate, you were succinct, clear. There are no questions. There are no comments. So I am, is that correct? That looks correct to me. So I'm hoping that we can support efforts to refine this program to better support the needs of our community partners. And with that, we are going to move forward. So at this time, I would like to recommend a proposal for the Commission's consideration. As you recall, the Commission supports stakeholder advocacy with funding for a range of populations, including the immigrant and refugee funds we just authorized. We do currently support advocacy for young children and transition-aged youth. However, that work is not focused on school mental health. I want to recognize that the Commission has called for elevating the voices of youth in our mental health system. We will have a presentation toward the end of this meeting on the governor's historic investments in youth, including new funds and strategies to strengthen school mental health. I would like to propose that we seek stakeholder advocacy funding dedicated to elevating the voices of school-age youth to support the work that is underway on school mental health. With the support of Assemblymember Carrillo, last year we sponsored AB 573 to establish youth mental health boards in each county to engage on school mental health and related issues. Unfortunately, as Norma shared, the bill did not move forward. However, we have an opportunity to approach this challenge through stakeholder advocacy funding. So I would ask that we support a proposal to direct staff to work with administration and the legislature to secure funds equal to what we provide to other populations, but here to focus on elevating the voices of school-age youth to inform the work that is underway on school mental health. I feel very strongly and very passionate about this. I work with youth every day, and constantly bringing them together. There's so many dollars going towards school mental health. And we have this unique opportunity in these last 2 years. We have seen youth really rise to the occasion to speak about their mental health, and they're tired of just having things done to them and for them and at them. They've become advocates. They have rallied. They are having discussions in so many different platforms, in so many different ways, at school, at home. And I think it's important that they be part of the solution and that they are able to shape some of the curriculum that we're putting forward. And so I'm hoping that I have the support of my commissioners. I'm hearing it from students, I'm hearing it from our youth, I'm hearing it from those youth serving agencies, and now's the time. So if we don't set the precedents, who will? So I'm asking the support of my fellow commissioners, and at this time, I would ask if there are questions, comments, if we can dialogue this. So commissioners, please. So I see hands raised. I see Commissioner Alvarez's hand and Commissioner Bunch. So please.
Thank you, Chair Madrigal-Weiss. So I appreciate your leadership and commitment to student mental health, both in your day job and as part of this commission, and wholeheartedly agree that this investment is necessary and that we have an opportunity to really streamline investments across the state and making sure that we are maximizing these resources that we're putting in, and in particular in responding to such a crisis that we know existed before the pandemic and that's only been worsened as a result. My only request to you is to really consider the definition of student to include our young ones, our babies, 0 to 5, recognizing that in order to be ready for school and be able to tackle education starting in kindergarten, those early years are critical, and finding ways in which we can support the healthy development of our young ones is essential to their overall student success. And I would encourage you to consider that as we explore what this priority will look like.
Thank you, Commissioner Alvarez. Commissioner Bunch, please.
I also appreciate you and support everything that you're saying. I just actually wanted to clarify. I'm trying to clarify the motion. So you have a motion, but then it seemed like Norma said she was going to have a motion as well. Are they the same or are they different?
They're different, and we will vote on them individually at the end. They are different.
And we haven't heard Norma's motion yet.
Oh God, did I skip that?
I just want to clarify. I didn't hear a motion.
But we're going to do it at the end of legislative discussion.
Okay.
Sorry.
I just wanted to clarify. Thank you.
Yes, so I'm asking that we support a proposal to direct staff to work with the administration and the legislature so we secure funds equal to what we provide to other populations. But here I want us to focus on elevating the voices of school-age children to inform the work that is underway on school mental health. So we haven't made the motion yet, but that's where I'm at. Thank you, Commissioner Bunch. Commissioner Gordon.
Thank you, Chair. I want to strongly support your proposal and the amendment from Commissioner Alvarez to include the 0 to 5 space. I think it's one of the things that we have benefited from tremendously in Sacramento. In the fall, our county board of supervisors appointed a youth mental health board to advise them directly on issues related to student mental health. And the group has met 3 or 4 times already. In fact, they meet tomorrow evening. And it's a tremendous assemblage of young people who are working hard to listen to their peers and come back to their adult allies and the Board of Supervisors with great advice. And it's very inspiring, and I think it will be of great help. And I think putting this in place throughout our state will give not only school districts, but our behavioral health departments, our county leaders, a view into what young people feel is needed and how we're doing in providing that. So I couldn't be more supportive of this, and let's go.
Thank you, Commissioner Gordon. At this time, I do not see other commissioners. So with their hands raised, I would say this, thank you so much for your comments on that. And I want to say that are there any other items relating to legislative priorities? So I brought this one forth. I want to also loop back, because this is where, when we were talking about the additional funding for immigrants and refugees in our last item, where Toby said, let's talk about this in legislative supports, bring it to this item then, so that it's just a cleaner flow here. So if commissioners want to bring up any other items relating to legislative priorities, this would be the time. So I would like to bring back, or if any other commissioner would like to bring back, the additional funding for immigrants and refugees. I welcome that comment I welcome your thoughts at this time. So I see Commissioner Templin's hand up. So Commissioner Templin, please.
Yes, thank you, Chair Madrigal-Weiss, for this opportunity and the reminder too. This is the right time agenda to have that discussion and advocate for that. And I'd like to request that staff to work with legislators to look for more funding for our funding to the RFP of supporting advocacy for immigrants and refugees. So I would like to make do we make a motion? Is that what it is right now?
We have
Add that
staff
to the
drafting
motion?
motions as we speak. So hopefully they're doing that. Is that correct, Toby, Norma? Thank you. Okay, they are, and we're going to vote at the end of the discussions. We're going to vote individually. So yes, please know that staff is working with us. They're drafting them as we speak. So thank you, Commissioner Templin.
That's right. So this point would be if there's any discussion among the commission on that topic.
Yes.
Then we'll have the public comment, which allows the commission to hear public comment on the what we have now are sort of 4 proposals that are under discussion. Thank you.
Yes, thank you. And is there any commissioner comment on what Commissioner Templin just proposed?
This is Commissioner Mitchell. I'm just thank you for bringing it back, because I was hoping it didn't get lost in the weeds. So I'm going to support that motion whenever it's drafted by whomever is writing it.
Thank you, Commissioner Mitchell. And I would hope that you always help me not lose things in the weeds. So thank you so much, Commissioner Mitchell. And so I have Commissioner Gordon and Commissioner Rolette, please.
Yes, I support Commissioner Templin's recommendation, and I would just like to amend it with a request that if at all possible, staff try to work to acquire funding in time to include it in this, if at all possible, in this procurement that will be going out shortly, so that we don't lose perhaps up to a year. Thank you.
Thank you, Commissioner Gordon. Commissioner Rolette, please.
Per the chair's request, I support the recommendation, and I support the amendment by Commissioner Gordon. And again, I think it's important work, and certainly we need the resources to do the important work in a timely manner.
Thank you, sir. At this time, I see no other commissioner hands raised. Any other items relating to priorities for discussion? I see no other hands raised there. So we have the 2 additional well, the one I proposed, the one that our Commissioner Templin proposed with the amendments, the 1 amendment from Commissioner Alvarez regarding including our little ones, as she always reference our babies, and the amendment that Commissioner Gordon put forth to, if we can do it as soon as possible, we would very much like to do that. So Thank you, everyone, for your patience and going through this with us in this way. All right, so at this time, we have several proposals for consideration. I'm going to ask staff to help me. We have the support for AB 748. That is Assemblymember Carrillo's AB 748 relating to the school posters. We discussed the modifications for SB 82, the Mental Health Wellness Act, also known as triage, and I believe we can have a slide on that. Is that correct? We can bring that up again. Okay. And then we have the support for stakeholder advocacy funding, which is approximately 600 and, are we going through each one?
I think what the opportunity here is to just remind the public and the commission, there are sort of 4 issues that will be voted on at the next step of this agenda item, just to remind the public so that we can make sure we get timely public comments before the vote. So as you said, the first one was support for 748. The second was to engage the legislature and stakeholders, other partners, to modify SB 82 to be more responsive to community needs. The third was advocacy funding to focus on school mental health, including 0 to 5 and K-12. That's currently $670,000 a year. And then the fourth is the direct staff to seek additional funding to support immigrant and refugee stakeholder advocacy, with particular emphasis on immediate opportunities to augment the funding we have in the current RFP. So we will review those on an item by item, but just reminding the commissioners and the public that that is the array of legislative priorities that are on the table at the moment. And you do have at least one commissioner with a raised hand.
Yes, Commissioner Bunch, please.
Is there any additional information about the changes to SB 82 and what you mean by making it more, sorry, the slide went away.
Yeah, so go ahead and put that slide up, Norma. So as you recall, in October, Veronica Kelly presented as part of we had a panel on opportunities for SB 82. And over the course of this project, which is actually about 10 years, there have been challenges with, go back, Norma or Cody, to the slide with the bullets. There have been a number of challenges with the program. The biggest challenge is that the program only allows the funds to be used to hire staff. And counties typically start programs with the SB 82 funding we provide them, and they then have to shut those programs down when the funding is gone, because it is very difficult to sustain staffing with when a state grant is over. On top of that, counties and their community stakeholder partners, community organizations that they contract with, will point out that sometimes what they need is consultation or training or other resources to really improve the continuum of care. So under the way the program is designed at the moment, it makes it difficult to sustain. This focus on staffing is the biggest challenge. And we actually often see difficulty from our smallest counties in participating. We saw that in the release of the Mental Health Student Services Act funding, that they couldn't even bring the staff together to submit a proposal to the commission. So what the proposal here is to authorize staff to engage the legislature, and through that process, engage community-based partners to think about how might we modify SB 82 so that it's more aligned with what's happening in our community mental health side. And, we would do that. We can bring that to committees. We will certainly, any language would actually be reviewed through the policy process in the legislature. We can bring draft language back to the commission. It's the idea of rolling up our sleeves and getting started as the legislative bill session begins. So we don't have actual language of what the new language would be. What we're suggesting here is, if we want to modify SB 82, we need to work with our partners to figure that out.
Thank you, Toby.
At this time, we will take public comment. Then we will move to take a vote on each proposal separately. Members of the public may request to make a public comment on item 3 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the queue, so please make requests to comment now. And at this time, I will pass it over to Marani. And please, let's begin public comment.
Okay, Chair, we currently have 9 public commenters. Matt, your line is open. You may go ahead.
Thank you. I'll make my comments brief. I wanted to address the commission on AB 748 and specifically build on the comments made by Madam Chair, Commissioner Mitchell, and Commissioner Brown. I too believe that this really should be youth driven, and I would urge the commission to support it with amendments. Specifically, when we look at subdivision B and subdivision C on the second page of the bill, page 43 in the meeting materials packets, those 2 subdivisions should include some mandatory language that youth or pupils in the school district will be involved in making these posters. Posters are obviously a great idea, but given that the youth will be benefiting and using the posters, they must be the ones involved in creating it. It really should be youth-driven, youth-led, and if we add some mandatory strengthening language there involving youth, it will address that issue. With respect to subdivision uppercase B3, I think the best practice would be to convene a student work group to create the model poster that will be then disseminated to all the school districts that can then use as a template. And if we fortify that language by including some mandatory language for the youth, that will be really the best way to accomplish that. And then building on what Commissioner Mitchell said, I do think this would be a great idea to have a competition where students from all these school districts could submit these in a statewide competition with stipends, awards, and perhaps the MHSOAC could support that endeavor. And it would be really great way to bring the youth together, have them present all their creative ideas and approaches, and really just facilitate this process and show that we're being youth-led, we're being youth-driven, and this is the best way to do it. And look at us being the shining example of how to do it. I'm happy to put those comments in writing. I'll send those to Director Ewing, staff at Assemblymember Carrillo's office, and the commission. Thank you.
Thank you, Matthew.
Rakaya, your line is open. You may go ahead.
Hi, thank you, Chair Madrigal-Weiss and the rest of the commission. My name is Rukaya. I'm a policy fellow from California Pan-Ethnic Health Network, or CPEN. I just had a question regarding SB 82. I remember during November's Cultural and Linguistic Competency Committee meeting, we were presented with a timeline for the 3rd round of funding for SB 82. And in that timeline, it was listed that there would be a presentation of the RFA outline to the commission on January 27th, so during today's commission meeting. And I understand that there is a motion to modify SB 82, but I was wondering if there's been like a new established timeline for the 3rd round of triage funding, and if so, if it can be shared with the public.
Maybe can you respond to that, please?
Sure. So yeah, as you can see from the agenda, we were not able to put the SB 82 time reauthorization on the agenda for today. We're working to finalize that under the current rules that we have as soon as we can. And I don't know if it's mentioned in the, we have a list of future topics, so it may be pushed back until February or March. We're working to make sure that doing that doesn't jeopardize access to the funding because of the deadlines that are in our own budget. Those deadlines are complicated and made more complicated because of the pandemic and the way the legislature and the administration has been shuffling some of these fiscal provisions, just in recognition of the dramatic need, the increase in federal funding that is available, and the procedural challenges that public agencies, including the commission, are facing. So, so we do not, I do not have an updated timeline for you at the moment that is finalized. What we had shared in the past was a target. We didn't meet that target. In terms of this provision around SB 82, the balance we're trying to achieve is making existing funds available as soon as we can under the rules that we have, and doing so in a way that supports our community partners, and engaging in a conversation about how we can strengthen that entire strategy and do it in a way that is timely. I hope that answers your question.
Thank you, Toby.
Okay, Stacy, your line is open. You may go ahead.
Stacey Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. With all due respect, I have made this suggestion before. I really believe that I love that the commission is interested in legislation and budget items, but I really believe you should have a committee so that these issues can be discussed thoroughly and stakeholders have an opportunity to weigh in on each one. Right now, we are going to have to weigh in on 4 measures all at once. And I think it's very difficult to remember for the commissioners as well as the stakeholders on all the points that we make. I also feel that it's not fair for you to put things in the motion and then not let us speak. For example, on the last motion, you added a lot of things, some of which I am very concerned about, to the Refugee and Immigrant RFP. And you made these things after the public spoke, so there was no way for us to respond. Again, I'm sorry, but it is frustrating and we have concerns. I will say the triage, I support these 4 motions in general, but I do have some concerns, again, like others on the triage, SB 82, communities of color, particularly organizations that serve racial and ethnic communities were not heavily involved in the development or in those grants. I think they should be, and not, as the director said, just at the legislature during the committee process. Many organizations do not have the capacity to lobby at the legislature. So if you do not engage them, it will be very disappointing. Again, on the others, I support, and I would just want to make sure that there is clarity between the grant that the chair of the Commission for Children and the TAY, if there could just be clarity, so to make sure they don't overlap, or if they overlap, if that's fine, just so there's more understanding. Thank you.
Stacey.
Okay, next, Tara, your line is open. You may go ahead.
Wonderful. Thank you so much. Tara Gamboa Eastman on behalf of the Steinberg Institute. We're deeply committed to ensuring that the vision of our founder laid out in 2013 with the SB 82 is carried out. And that includes revisiting the legislation to see what's worked and what hasn't. While there have been a number of challenges implementing SB 82 and additional flexibilities could help fully realize the potential of the Act, we believe that additional flexibilities would need to be partnered with targeted outcomes for counties to achieve within the crisis triage work. We will also note concern about diverting funds away from workforce investments given the crisis level workforce shortage we're facing at the moment. We look forward to continuing to partner with the Commission and the counties in this work and seeing additional details. Thank you so much.
Tara.
Steve, your line is open. You may go ahead.
Thank you. My name's Steve McNally, and you just have to live with the caricature because of my internet access. I am a member of an Orange County Behavioral Health Advisory Board. All my comments will be my own and not reflective of that particular board. I'm supportive of all that discussion that went on. There's a couple of things I just want to make sure they're included when you all review this stuff, because details are really important. And so I go to a lot of meetings, and very rarely do people refer to like the Department of Healthcare Services bulletins that have the specific details that counties are required to follow. And so people talk off their top of their head about lots of topics, and then it gets a little convoluted. And I agree that we need to make sure that things are sustainable, particularly with all this money that California has. And I support getting the money to the captive audiences in the schools, certainly, and they're very hard to get into. But with the new money, as a citizen, I find it really difficult to manage how much money, who has the control of the money. And, you know, we have county systems that don't work well together with the silos, and we're going to be asking them to work well together. So I'm going to make a pitch again that this group, the California Behavioral Health Planning Council, gives you another 40 people, and your local boards that are mandated by the state that really aren't able to, in many cases, to do their statutory duties in the WIC code 5604.2, that you look to them as your 900 people into the communities to gather information and bring it back to you, or to inform the communities what's going on. And the one group that you can get to on those boards are 59 electees, usually a supervisor, but sometimes there are a couple of cities. So please, let's not forget that on paper, there's a state to local, local to state connection. And yet we're really very siloed ourselves, except for a little bit here and there, and if people happen to pop into a meeting. So I thank all of you, and I didn't have a chance to say anything earlier, but Tina Wooten was very, just very supportive of everyone. I think that's a great thing for us all to remember, to have trusted relationships when we're all working together. Thank you.
Thank you, Steve.
Pashi, your line is open. You may go ahead.
Thank you, everyone. Thank you for the opportunity to speak again. Pashi Walker, pronouns Z0Zers, and I'm still with Cal Voices. I first of all would like to support Stacy's comments about having legislation options go through a committee first, and also include some transparency on why some mental health bills are brought forward to the commission while others are not. We have no idea why those are chosen. And the fact that there has always and traditionally been a lack of presentation of any opposing points of view on the actual presentation panel. Usually it's just the author that's being brought forward. Of course, they're going to support their own legislation. I think it's good for commissioners to get to hear both sides. I am particularly concerned, not because I either support or oppose, but the proposal to ask for further funding for yet another stakeholder advocacy project. First of all, I'm concerned that by not having that on the agenda or in the materials, that it doesn't meet Bagley-Keene standards and doesn't give an opportunity for others to come and make public comment regarding this. Also, I'm concerned that you may not get what you want and that there might be unintended consequences. The commission is completely unaware of the work that the existing stakeholder contractors are doing, and so therefore don't know how much of that work was done with school age kids or around school age kids. But also, rather than taking another $670,000 out of the budget, and I'm not sure if this comes out of MHSA funding or not, there's also the opportunity to maybe increase the contracts of some of the current stakeholder populations contracts that intersect. And so, for example, since I obviously represent LGBTQ, there are very specific LGBTQ needs and disparities within the schools that do not necessarily also meet the standard of looking at just, oh, we're just going to look at mental health. But rather there's an intersection, and there's a lot of work therefore that could be focused on if that was put in the next RFP. Unfortunately, our current contracts don't even allow us to do that kind of work because we have to focus on the behavioral health departments. But we could do much more focused work and much more focused advocacy, and you might get more bang for your buck if you instead put a school component in for the next, for either the current or the future stakeholder advocacy populations. And my point is this: that discussion cannot happen if today you vote yes or no, especially if you vote yes, because now they're just going to go off and do it. I think these types of things need to be presented to the public in a timely manner. That's what Bagley-Keene standards are for. And again, not that I oppose or support. Obviously, the needs of school-age kids and our babies are incredibly important to all of us, but rather I would like to make sure that we get the consequences that we intend and not the consequences that we don't. So I hope you take that into consideration today as you vote. Thank you very much.
Thank you, Pashi.
Jeremiah, your line is open. You may go ahead.
Chair Madrigal-Weiss and Vice Chair Alvarez and the commissioners. I appreciate everyone's longstanding commitment and advocacy to individuals across California and being here today once again with you. My name is Jeremiah Aha. I serve as Assistant Director for Wellness Together School Mental Health. We're a nonprofit that partners with school districts across the state to provide on-site mental health services, and proud to co-sponsor the Student Mental Wellness Conference with the California Department of Education. So there's plenty of research available illustrating the harms and the unforeseen costs of social media platforms, as you probably are all aware. Center for Humane Technology has a very helpful documentary, award-winning documentary called The Social Dilemma, that if you haven't seen it already, it really illuminates this. At the same time, as there's much conversations that probably many of us are leading on the harms or, again, the unforeseen costs of these platforms, there's also this truth that the youth that are growing up today are living in a very, very different world than when we grew up. Most of us way back in the 1900s, right? And the big difference is that they're growing up in a world where it's normal for them to have unlimited and free outlets for their opinions, their perspectives, their convictions to be heard at scale. So not just with their friends, not just in their classrooms or within their spheres of influence, but around the world. And they don't know any other world than this one right here, this kind of 24/7, 365, always connected age, where there are plenty of corporations that are encouraging them, enticing them to share their thoughts, their opinions, for everyone to hear. And sadly, in many cases, this is then exploited for financial gain for corporations. But I bring this up just to share that our students are eager, and they're growing up in a world where it is normal for them to share, and they believe they're being heard, and they believe that their voice matters. And I'm advocating right now for the recommendation that Chair Madrigal-Weiss brought up for the future legislation and any advocacy moving forward, that it is led by our youth. It's critical when shaping mental health programming, and may the youth lead us in this very important work ahead. I applaud the commission and other great organizations across the state for holding sessions for listening to youth and for highlighting their voices. It's one thing for us as adults to listen to youth and to say that we're listening. It's quite another to have them lead us into the work that needs to be done. As a licensed therapist, I've sat with many students and many families, and even as a parent myself, I know that I fall victim to a lot of times there's things that I do for my child, or there's things that parents and guardians do for their children that is not actually for the student, but it's actually for us as the adults and for our own maybe insecurities or maybe motivations that we might have. And so I'm urging us to not only just elevate the youth voice, but really lean in even further, as they have many platforms available to them. May the platforms that we create here give them the resources and the permission to lead, because when they do incredible work. Thank you so much.
Thank you, Jeremiah.
Anna, your line is open. You may go ahead.
Hi, good morning, commissioners. This is Hannah Bickoff again, Policy Director at Cal Voices. I have a very brief comment this morning, and I just want to commend the commission for really responding to the community need in going to the legislature and asking for an increase for the amount allotted for the RFP for immigrant and refugee populations. I felt that there was a really rich discussion today in supporting the Afghan community, and also you know, the hundreds of thousands of people who have been impacted by Title 42, who await asylum at our southern border, and the many, many supports that will need to be in place to help them with the impacts of PTSD and the trauma they suffered. So it's really, really enlightening and inspiring to see these type of decisions being made that are so responsive to the communities that need it most in our state. So I just wanted to thank you all this morning.
Thank you, Hannah.
Chair, that was the last official public commenter. There were 3 others left, but I'm not sure if you want to take them or not.
I think at this time we are going to move forward. We are following, where are we on that? So if we can move forward.
Okay.
Thank you. So we are okay. Yes, I'm sorry. If we could please, now, thank you for your public comments. I would ask then staff, please assist me with this. I'm sorry, Commissioner Alvarez, did you have a comment? Did you just want to wave and say hi?
No, I was just making sure I was still a member of the public, that's all.
Okay, you're still here with us.
Yes, I'm here.
Okay, thank you. So,
Mara, sorry
yes.
to interrupt you. I have, Cody has a new slide. I updated the 3 and 4 motion. And so Cody can bring that up now for us.
Okay. So thank you. So we wanted to be really clear about what we are voting on. So we've asked staff to, as we have been having this discussion and listening to public comment, to update what we would be voting on. So these are the motions. So at this time, the first motion then, so do we have any other questions or comments? I'm sorry, from our fellow commissioners after public comment? And because there is a slide, yes, Commissioner Rolette, please.
So I have one question as it relates to, and the chair may want to defer me to staff, but I'm sure it's in the slides, but your recommendation as it relates to the restrictions associated with Bagley-Keene, or the rules associated with Bagley-Keene, that information was presented or was included in the agenda so that the members of the public could look at all 4 of the recommendations prior to us making consideration of a vote. And let me just apologize for the awkwardness associated with that question. But again, just to be clear, that I wanted to make sure that members, as it relates to Bagley-Keene, that members of the public had a chance to look at all of the items prior to us voting.
Oh, sir, thank you so much for the question. So I will defer to staff and to be clear what we're asking for, what exactly the request is or what we will be voting for. So Toby, if you could please clarify for us.
Yeah, so Bagley-Keene requires the commission to put an item on the agenda that provides a reasonable person the opportunity to understand whether or not they should participate in the meeting. In other words, the agenda is required to ensure that the commission doesn't take action on issues that someone who had an opportunity to engage wasn't made aware of that, right? No surprises. It doesn't require there to be a level of detail that the specifics of a motion, for example, were displayed in advance. That would actually prevent the commission from actually being able to deliberate in the public space and then take a vote. The agenda item in reference to the public comment is legislative priorities, and it very clearly states that the commission will be discussing legislative priorities, for consideration. The 2 of the 4 were explicitly included in the materials that were distributed. 2 of the 4 came out of the deliberations of the commission itself, and the specifics were not mentioned in advance. I will point out that the motion is actually to direct us to talk to the legislature. And in the legislative process, so that conversation actually happens in public as well. So there is plenty of conversation that will happen in the public domain that will allow all stakeholders to weigh in. Three of these. So the first one is to talk with the legislature and stakeholders around modification to SB 82. The second is to have a conversation with the budget committees, which is done publicly, around additional funds for immigrant and refugees. And the third is to have that conversation around stakeholder advocacy funding. And all of those, there will be conversations on the Senate side and the Assembly side. And so, you know, my interpretation, understanding, and in consultation with our legal counsel and the Department of Justice is there is no Bagley-Keene violation here. But should a member of the public want to raise that issue, there is a process for doing so, and we'd be happy to engage in that process if it is warranted. Does that help, Commissioner?
It does. Thank you so much. I appreciate the clarification.
Thank you. Any other commissioner comments or questions? Okay. So then at this time, I would ask for a motion for Assembly Bill 748. From one of my fellow commissioners.
Really quick, Chair, had you added on anything to the motion?
Yes, we will have each one of the 4 commissioner bunch we will have on screen.
But for the first one, for 748, I thought you'd added something onto it.
I think one of the speakers may have added, but
No, but does this include any of the conversation that our commissioners added to this?
So just to clarify, so commissioners made a number of comments about working with the Department of Education and engaging. And so some of that conversation is, you know, would happen after the bill would be passed in the event that it is passed and signed by the governor, right? And so the motion is broad here is to direct staff to communicate our position in support of SB 748. Ultimately, the bill is Commissioner Carrillo's bill, and they've been participating in the call and have heard some of these comments. And so, you know, if we could make, it's not clear to me sort of what the very specific issues are that were communicated. Some of the public said condition the commission's support on modifications to the language. You know, I just want to recognize that this bill was brought, as evidenced by Ms. Shu's testimony, was brought to the legislature by the California Association of Student Council. So it sounds like it was already written by youth. And so, you know, part of that discussion would be, you know, how might we strengthen it? We would be happy to bring back any concerns and present to the commission any amendments that the assembly member might take moving forward. But typically in these scenarios, it's difficult to set a very specific line on when to support and when not to support, because then any changes to the bill have to be revisited every time the bill is amended.
I mean, I guess, Toby, my concern is with it being so broad that the result could be none of the very specific and really important ideas that were brought up by commissioners will be taken into account. And we'll have schools, you know, being given really generic posters that are not as helpful for the students as they could be.
So in this instance, given the challenges of a public process and deliberation, again, as we did earlier, this is where staff's recommendation would be for the commission to delegate to a member of the commission the role of engaging in some of these specific conversations with the author's office. And that way, you know, you're transmitting the voice of the commission directly in those day-to-day meetings, but it does, I'm sorry, they're not, I'm not asking you to do something every single day, but in those meetings that occur throughout the course of the bill process, and ask us to bring back the specific language should there be modifications, because that process happens very dynamically, and it can be very difficult for staff to determine at which point an amendment no longer is consistent with the commission's voice.
So I would move, just to keep the conversation going, I would move that we support this Assembly bill and direct staff to communicate and reflect all of our comments as appropriate, recognizing we're at the beginning of a long legislative and budget process that will continue for some time.
Thank you, Commissioner Carnevale.
Can I second that?
I'll second that.
Thank you, Commissioner Bunch. Commissioner Bunch seconds the motion. I would ask Maureen.
All right. I will take roll or
Thank you.
on the motion. On the motion with Ms. Commissioner Carnevale's last comments, Commissioner Bontrager, yes or no?
Yes.
Thank you. Commissioner Boyd, Commissioner Brown.
Aye.
Thank you. Commissioner Bunch.
Aye.
Thank you. Commissioner Carnevale.
Yes.
Thank you. Commissioner Creo. Commissioner Chen.
Aye.
Thank you. Commissioner Cortese. Commissioner Danovich.
Aye.
Thank you. Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Yes.
Thank you. Commissioner Tamplin.
Aye.
Thank you. Vice Chair Alvarez. Vice Chair Alvarez.
We need to make,
Okay.
we need to make her a host so she can unmute.
Thank you. Yes.
Okay. Chair Madrigal Weiss.
Approved.
Okay, the motion carries.
Thank you. Next item, please. So the commission authorizes staff to engage community partners and the legislature to modify SB 82 Mental Health Wellness Act triage to better address the community needs, as was presented to us by Ms. Norma Pate.
I'll move this. This is Commissioner Rolette.
Thank you, Commissioner Rolette.
I'll second.
Thank you, Commissioner Alvarez. Maureen?
I will take the roll. Commissioner Bontrager.
Aye.
Thank you. Commissioner Boyd. Commissioner Brown.
Aye.
Thank you. Commissioner Bunch.
Aye.
Thank you. Commissioner Carnevale.
Yes.
Thank you. Commissioner Correa. Commissioner Chen.
Aye.
Thank you. Commissioner Cortese. Absent. Commissioner Danovich.
Aye.
Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Yes.
Commissioner Tamplin.
Aye.
Vice Chair Alvarez.
Aye.
Thank you. Chair Madrigal Weiss.
Approved.
Thank you. The motion carries.
Thank you. So motion number 3 is to direct staff to seek stakeholder funding consistent with other funding levels for school mental health advocacy, including 0 to 5 and K-12 focused on elevating voices of students. So this does include the amendment that was added by Commissioner Alvarez. So at this time, I would ask for a motion.
So moved.
Thank you,
Second.
Commissioner Mitchell.
Second.
Was that Commissioner Gordon?
Yes.
Thank you, Commissioner Gordon. Maureen?
Yes. In favor or against Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown.
Aye.
Thank you. Commissioner Bunch.
Aye.
Thank you. Commissioner Carnevale.
Yes.
Thank you. Commissioner Correa. Commissioner Chen.
Aye.
Thank you. Commissioner Cortese. Thank you. Move on. Commissioner Danovich.
Aye.
Thank you. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Roulette.
Yes.
Thank you. Commissioner Tamplin.
Aye.
Thank you. Vice Chair Alvarez.
Aye.
Thank you. Chair Madrigal Weiss.
Approved.
Thank you. The motion carries.
Thank you so much. And now, motion number 4. Direct staff to seek additional funding for immigrant and refugee stakeholder advocacy, including opportunities to increase available funding in the current competitive procurement. So that does add Commissioner Gordon's amendment asking, and please, if I got that wrong, was it Commissioner Gordon, to move on it quickly sooner rather than later. And so do I have a motion?
I'll move the item.
I'll second.
Thank you, Commissioner Gordon and Commissioner Templin. So I would ask that we take roll, please, Maureen.
All right. Commissioner Bontrager.
Aye.
Thank you. Commissioner Boyd. Commissioner Brown.
Aye.
Thank you. Commissioner Bunch.
Aye.
Thank you. Commissioner Carnavale.
Yes.
Thank you. Commissioner Carrillo. Commissioner Chen.
Aye.
Thank you. Commissioner Cortese. Commissioner Danovich.
Aye.
Thank you. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Roulette.
Yes.
Thank you. Commissioner Tamplin.
Aye.
Thank you. Vice Chair Alvarez.
Aye.
Chair Madrigal Weiss.
Approved.
Thank you. The motion carries.
Thank you so much, Maureen. Thank you, everybody, fellow commissioners. Thank you for your patience in this process. Again, we tried something new. I tried something new, and lessons learned from that. I will move forward and just see how this goes. At this time, I would like to, we have the governor's staff who are here to present. So I'm going to move the agenda a little bit. We're going to move forward with item number 5 first. So we have governor's proposed, no, I'm sorry. Yeah. Yes, I'm sorry. We're going to move to item number 5. So I'm very excited to hear a presentation on the governor's proposed 2022 budget for the Health and Human Services Agency, which will include the Children and Youth Behavioral Health Initiative. The budget proposal expands the state's investment in mental health and presents specific opportunities to improve how we respond to urgent needs. At this time, I would like to welcome Stephanie Welch, who is the Deputy Secretary of Behavioral Health at the California Health and Human Services Agency, and Melissa Stafford Jones, who is the Director of the Children and Youth Behavioral Health Initiative. Members of the public may request to make public comment on item 5 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue. So please make requests to comment now or as early as possible during the presentation. Ladies, thank you both for being here with us today. We appreciate your time. Stephanie, please begin with your presentation.
Great, thank you. Nice to be here. I'm wondering, do I put my slides up, or are those, I just don't see them, but.
I have them. One moment, please.
Oh, sure, no problem.
Sorry for the delay.
That's okay. I just wasn't sure if there was something I wasn't seeing, but it's nice to be here. I'll take this opportunity while we're getting queued up here to just introduce myself. I don't think I've been or had the opportunity to meet some of you before, and I do appreciate having the opportunity to do so today. I have been in this role for a little over a year. I came in kind of peak COVID surge and spent a lot of my time the first 6 months really working on our COVID response issues and how it was impacting our behavioral health community. So it's really fantastic to be able to be here today to talk about some of the things that we're working on. I'm going to go first with kind of a broader overview and then pass the baton off to Director Stafford Jones to share some information about the Children and Youth Behavioral Health Initiative.
So first I wanted to share a little bit about our agency and some of the work that we're doing on a real kind of broad level. And we've gone through some changes. There's obviously a great commitment from this administration to improving health and human services. And we really wanted to bring our departments together and really row in the same direction and be very focused on similar goals. And so I'm going to talk a little bit about that. And one of the things that we did do is we also kind of did some rebranding. So we really wanted to focus attention and effort on the fact that this is the California Health and Human Services Agency, and that what's best for all Californians is at the heart of everything that we do. Our tagline in our new logo also really points out the kind of guiding principles that we'll go over in more detail, but kind of some of the key things that all of our departments and offices are focused on. We do have 12 departments and 5 offices in our agency. Those range everything from the Department of Healthcare Services to the Healthcare Access and Information Department, which is a new department, and offices like the Office of the Surgeon General and our Office for Data Innovations and Insight. Next slide. So like everybody else over the course of the last now 2 years, we have been living through this pandemic. But in every moment that we've been living through it, we've been using it as an opportunity to figure out how we can do our work better and be more specifically focused on addressing the needs of Californians. And so I certainly don't have to tell the audience that I'm speaking to that COVID-19 has had a detrimental impact on Californians' behavioral health. That being said, it exposed things rawly in a way that has motivated us to really accelerate our commitment to behavioral health transformation. So clearly, I'm sure you guys were very involved. I know you were involved in addressing some of the impacts that COVID-19 had on the behavioral health of Californians, even early on, just trying to keep people safe and knowledgeable about the pandemic. But of course, the pandemic, of course, exacerbated a lack of access to behavioral health care. I feel like that's how I cut my teeth in this position, was trying to figure out how we would still make behavioral health care accessible when we were in the middle of a lockdown. And so it just exacerbated something that was already very difficult for the vast majority of people to access. It exposed really inadequate capacity. I think we'll talk a little bit about that in a moment, but we have had workforce shortages for decades. And this kind of put it right in our face of how incredibly inadequate our capacity was in the workforce space, as well as our lack of facilities and most notably appropriate community placements for people who had serious mental health conditions, including appropriate housing. And I think the thing that we've all been keenly aware of, but COVID made it so that we must completely change the way we do things, which was witnessing this incredible disproportional losses by communities, different ethnic groups, cultural groups, age, health status. You guys are well aware of the fact that while maybe our older Californians were the most physically impacted by COVID mental health, it was our younger Californians who were emotionally and mentally impacted by the pandemic. Next slide. So with some of these learnings, we've gone through a process in the last 2 years at Health and Human Services with all of our departments and offices to think about how do we want to do what we do. And so our guiding principles are really about the how in what we do. And so we want to focus on equity. We want to actively listen in our various different task force committees, opportunities like we have today. We really want to focus on using data to drive action, which I know is something that's very important to the commission. We want to see the whole person and also put the person back in person-centered care. So I came in at the end of the last conversation, and I think I really want to lift up the commitment that the commission has had to youth voice and the voice of people with lived experience. I think for us, what this means is that when we think about improving systems and designing systems different, we need to understand how a person or a family experiences that system on the ground. Sometimes that's very hard to do in an office in Sacramento, especially during a pandemic, but it's really, really critical to basically look at it from how do we improve the consumer and user experience of behavioral health services. We want to cultivate a culture of innovation. We want to not just tweak around the edges, but really look at how we do something and determine if we should, apologize, let me turn this off, determine how we do something and figure out if we just need to do it completely different. So you guys have been a leader in this space. So I think this is an excellent area for us to work together on. And of course, most important, to deliver on outcomes. That is difficult. I know you guys are been pioneering some things over here. So I look forward to future conversations about how to do that. So next slide. The next slide outlines our strategic priorities. So this is really the what. This is the where we want to focus our energy. Obviously, we want to create a equitable pandemic recovery. And that is going to be a part of every policy that we look at going forward. We want to build a healthy California for all. I hope that's reflective in some of the priorities that we've put forth in the budget, including expanding Medi-Cal for all. We want to integrate health and human services. And as Deputy Secretary, that's a lot of the work that I do, is making sure that I'm supporting our departments working together on joint initiatives. We want to improve the lives of the most vulnerable. That was very clear in this year's budget. We'll talk a little bit about that in a second. We want to advance the well-being of children and youth. And I think Director Stafford Jones will touch on that, being some of the work that we introduced last year that is ongoing. And we want to build an age-friendly state for all. We have an incredibly growing demographic of aging Californians. And not only do we want to improve their healthcare and their social services, but we actually really want to empower them to have the best lives that they can. That means coming back to the workforce, being a caregiver, and being supported in all of those efforts. Next slide. So tying kind of our two topics together, I think I really wanted to highlight kind of what we have today and what our system looks like today. And unfortunately, the behavioral health care system and the folks who are receiving services in the deeper end of our system have really experienced a lot of drivers of social determinants that we really need to tackle. So these are individuals who experience poverty. They have high levels of disability or poor physical health. They've lacked opportunities for education and employment. They've certainly been disenfranchised, discriminated against because of their mental health status, marginalized, and experienced multiple traumas. I'm not saying this to be a total downer, but these are all the things that we want to erratically address so that the next generation of Californians, or the current generation, I don't want to say the next, has a very different experience when it comes to behavioral health care. Next slide. So this administration has been dedicated since the beginning to transforming the behavioral healthcare system. We did our best to continue on that path in the middle of a pandemic. And I just wanted to walk through some of the things that we have in motion already. They're very big areas, and I think to a certain extent, sometimes it could be overwhelming. But I thought it was really important for us to share kind of the landscape of change and kind of the enormity of the amount of change that we're undergoing at the same time. But we really are weaving these things together. So first and foremost, our California Advancing and Innovating Medi-Cal is an effort to really modernize and simplify Medi-Cal's behavioral health system. I bring it up because CalAIM is doing a lot of different things for a lot of different people, but probably the most radical changes that it's making are to our Medi-Cal behavioral health system, and basically making sure that whether you're have a mild to moderate condition or you have a more serious mental illness and need specialty services, the user of the system shouldn't recognize that they're going and moving between two systems. And we have to support our providers by making it easier to administer and provide services. And so very excited about that. Our waiver was approved the very, very end of last year. And we are launching into several different elements of implementation. You will hear more about the Children and Youth Behavioral Health Initiative, but it's no small feat that $4.4 billion has been invested to completely reimagine the behavioral health system for children and youth, and you all are a part of that. The Behavioral Health Continuum Infrastructure Program, this is actually one of my favorites, but I'm super excited. We will be launching the first, or sorry, it's not the first. We have our mobile crisis RFA already out, but the first big RFA for this program next week. And this is really going to give communities an opportunity to build out both facilities and community-based care and residential placements in a way that we've never really invested before in the community behavioral health system. Incredibly important is the workforce behind this new vision of our system. That workforce has to be full of supported peers in good paying jobs. And so it's really exciting that we have our peer support benefit in Medi-Cal. And we've also established an Office of Suicide Prevention, something that this commission was an advocate of. Next slide. We are moving forward with mental health parity enforcement, which is really critical in supporting our Department of Managed Care to have the resources and capacity to do so. We have our CalHope program, which is a crisis counseling assistance training program. And we are also in the process of prepping for 988 implementation. On the substance use treatment side, which is really a part of our system we're deeply dedicated to building out, we have our California Medicated Assisted Treatment Expansion Project, which we are expanding more in this year's budget, as well as piloting a contingency management program in our outpatient settings. We are working with our counties to provide incentives to better integrate behavioral health services. And for those of you who know me well, we stay committed to trying to resolve our incompetent to stand trial crisis by expanding diversion programs for these individuals rather than increasing the capacity of our state hospitals, because we truly believe that these are individuals who can and should be served in their communities. Next slide. So what's different this year? And I know you guys also had a presentation, so I'll go quickly so that we can get to Melissa's presentation, but we really doubled down on efforts to address the needs of vulnerable communities. And so I think what I wanted to really highlight here is, while we had these incredible investments last year that we're launching this year, it will take several years to materialize. We can't, as you guys know, working on the triage grants, we can't necessarily have a building in 1 year. And so this year we're putting forth $1.5 billion in behavioral health bridge housing. This is really focused on people who are experiencing homelessness already and or are at imminent risk of homelessness. Obviously, we have a housing crisis that seems to get worse on a regular basis, and we really want to double down and make sure that for those individuals who have very serious behavioral health conditions, that we have resources available right now to provide time-limited operational supports for alternative housing settings, including existing assisted living settings. This is really, really focused on our folks who might be suffering the most as a part of the pandemic crisis and need housing immediately. We are also really doubling down on our efforts to address the incompetent to stand trial crisis. This slide says that we have nearly 1,700 individuals who are currently incarcerated on an IST on an IST finding for a felony charge. That number is actually closer to 1,800. Some of that's because of the Omicron variant, but again, it's something that we absolutely believe we can resolve by investing in community services and investing in diversion and community-based restoration. Next slide. Something that you guys have also been very involved in and supporting our counties with their skill building in this space would be mobile crisis services. We are pursuing the opportunity made available to us by the federal government to have multidisciplinary mobile response services as part of a new Medi-Cal benefit. We are being aggressive with this, and we are going to try to make this happen. Well, I shouldn't say we're not going to. DHCS wouldn't be happy. We are going to make this happen as of January 1st, 2023. So incredibly excited about building out our crisis care continuum. We also are, as part of our larger CalAIM package, providing access and transforming health through our PATH programs. No small number there either, $1.3 billion over 5 years to really support the development of enhanced care management and community supports under CalAIM. These are the additional supports to really wrap around the person to support them in their journey on better health. Things like housing supports, transportation, etc. So very excited about that, as well as a specific set of services in that space to support individuals who are justice involved, who are returning home from jails and prisons. And then lastly, a couple of planning efforts, which I know aren't as exciting, but they are going to be housed at our agency. We will be conducting a crisis care continuum planning process. I know that that's probably something of interest to all of you. More to come on that. And we also are committed to completing the process of developing the foster care model of care, which is a set of services under expanded services under CalAIM for our foster care youth. Next slide. Again, I mentioned that we are really committed to building out our substance use treatment system. I think this is definitely a priority within our behavioral health continuum infrastructure program I mentioned earlier. But here we are really focusing on the immediate crisis with the opioid epidemic. So here we are going to, a majority of these funds are going to expand our access to MAT, medicated assisted treatment around the state. And then we have some one-time funds we're going to really use to focus on a youth opioids education and awareness campaign, really focusing on the risk of fentanyl, as well as some other investments on making sure that we have naloxone, that there is naloxone available to our homeless service providers, and training around opioid treatment for our primary care docs. Next. I think this is something people have been waiting for. We do, of course, have a very significant workforce investment as part of the Children and Youth Behavioral Health Initiative that Director Stafford Jones will mention in her slides, but did want to mention that this year's budget has another really significant workforce investment. I think the thing I really want to underscore with this workforce investment, and you can read the various different components on the slide, is that this is really doubling down on really wanting to support individuals to come into the care economy workforce in a way that they can have a good paying job, that there is a ladder to promotion, and that they're really meeting people where they're at. And so we're really excited about these initiatives to expand our community healthcare workforce, our multilingual workforce, and individuals who frankly just don't have the time or capacity to go to school full-time to do things like receive their social worker license. Next slide. So this is our website, which we recently refreshed. I hope it can be a resource to you. There are blogs there, there are newsletters there. You can sign up for other information. And this time I'm going to pass it over to Melissa Stafford Jones to go over her presentation for the Children's Initiative, and then we'll take questions at the end if that's okay. Melissa?
Good afternoon, everybody. Thank you to the Commission and to Toby for inviting us to be with you today. And I want to really thank Deputy Secretary Welch for her presentation and really laying out that comprehensive behavioral health agenda the administration has and how the Children and Youth Behavioral Health Initiative is one of the key components of it. So today I want to spend a couple of minutes just introducing myself. I'm 2 months into my role as Director of the Children and Youth Behavioral Health Initiative. So I wanted to share with you a little bit about my background. Wanted to give you an update on the approach we're taking to the planning of the Children and Youth Behavioral Health Initiative, give you an overview of the initiative itself and some of the key work that's happening and some next steps that will be coming. So thank you again for the opportunity to be with you today and to take this time for this discussion. So just to start for a moment to introduce myself, again, Melissa Stafford Jones. My background is primarily in health policy and work in the safety net related to Medicaid and uninsured populations, very much focusing on having an extensive system of care that supports access, quality of care, and improving health outcomes for underserved populations. I've had the opportunity to work at the federal, state, and local levels in a variety of roles as a health policy leader and advocate inside government, in philanthropy, running nonprofits. So a range of roles, but all in this area of work. And increasingly, over the last many years, in some ways returning to my public health roots of the social determinants of health, which is really thinking about health from a holistic point of view, and all of the critical factors that really address the health of a person in a community in an integrated way. And that is really in part what drew me to the work of the Children and Youth Behavioral Health Initiative, because it is focused at a systems level of how do we improve the social emotional well-being and behavioral health of our children and youth. It is very much centered on centering the voice, the experience, the priorities, the strengths, the needs of children, youth, and families, and all from the perspective of really focusing on equity. And so I really feel very humbled and honored to be able to be a part of this work in the administration and with many partners, such as all of you. I also wanted to just share by way of introduction 2 things, which is one that, as I mentioned, one of the transformational aspects of this initiative is its very intense focus on equity. And I just want to acknowledge as a white leader of both white and economic privilege that I'm very cognizant of that in our work around equity and the importance of recognizing that often we have the inequities we have because of the structures and systems and power structures that we have. And part of our work is to disrupt some of those systems and take the opportunity to rethink and reimagine them. And that part of my role is to create the space for that possibility to occur. I also just want to note that as is the case, I know for many of us in this work, and I'm sure on this call, this work is also personal to me. I'm sure like many of you, I have very close family members that have struggled with very serious both mental health and substance use issues. And the work as a family member and experience as a family member, trying to support their well-being and thinking about what are the opportunities we can do that from a community and systems and policy perspective is part of what draws me to this work. So just really appreciate the opportunity to be here. And I share that in part because part of the work of this initiative, and I know part of the work of the Commission and our partners, is around addressing stigma. And so I share it in the sense of wanting to recognize that this is actually work that all of us are really addressing in different ways in our lives. So I have been in my new role for about 2 months. I've been doing a lot of listening, a lot of learning. I know I'm doing a bit more talking today, but I'm really looking forward to the Q&A and discussion part where I can continue in that work of listening and learning as we really come together to shape the work of the Children with Behavioral Health Initiative. Next slide, please. Next slide. Great, thanks so much. So this is a slide I don't need to go over with this group. I just note it because it is the basis of the imperative for this work, and it is an imperative. You all know very well, I don't need to go through any of these statistics and trends that we are seeing in terms of dramatic increases in behavioral health issues and needs for children and youth. Before the pandemic, exacerbated by the pandemic, with the stress, the isolation, the trauma, and the challenges it has brought, both related to mental health and substance use. But I think it's important to anchor ourselves in these data points and recognition of them about how it really is part of what is driving our work of what an incredible imperative and importance this work is. Next slide, please. And also just the impact that this work has in terms of the recognition that behavioral health for all people, but including our children and youth, really has very long-term effects on their health, on their well-being, on their learning, on their life opportunities, and that we have this opportunity to come together to work on really rethinking our systems for supporting the social well-being of our young people, and what, by doing that work, what it will allow in terms of their opportunities to thrive. And so, you know, given the scope, the scale, the importance of this issue in terms of the data we saw on the prior slide and the potential impact this work can have, you know, the governor and the state legislature came together in California last year and approved this initiative. And it's a bold investment in the well-being of our children and youth to really address this long-term crisis with a long-term transformative approach. Next slide. So the Children and Youth Behavioral Health Initiative, what is it? What it is it is seeking to reimagine the systems that support behavioral health for all of California's children and youth ages 0 to 25 into an ecosystem, a coordinated, integrated ecosystem that fosters social and emotional well-being, prevents behavioral health challenges, and provides equitable, appropriate, timely, accessible services for emerging and existing behavioral health needs, both mental health and substance use. It really is an ecosystem approach, so both focused on the full continuum of care with a strong focus on really thinking about the upstream population-based prevention efforts that can provide early supports before behavioral health issues emerge, and help build the capacity for wellness with those early supports and interventions, and also making sure that across the continuum, we are building systems and supports that address needs that do arise for our children and youth in a way that truly centers their needs and their experiences. Critical to, of course, doing this reimagination of the ecosystem is partnership and is collaboration. And in that work is cross-sector. It's not just in health and human services, it's with our education partners, including early learning, TK through 12, higher education, colleges and universities, and other parts of the ecosystem, including community-based organizations, and of course, most importantly, children, youth, and families themselves in this work. So in my couple of months in the role, one of the things that has been very, very clear is how shared the vision is for the ecosystem that would support the well-being of children and youth. This is not an initiative where we have to spend our time bringing people to the vision. There's an incredible level of mutuality and commitment and dedication and passion for this work and for executing on the possibility of the initiative. I would also say some other real themes from the first few months is the recognition of the silos that we have, and that addressing those silos is critical to both reimagining the ecosystem, but also ultimately implementing it and developing the future state that we want to have of an ecosystem of behavioral health that really supports improved outcomes for children and youth. Also a real emphasis on both prevention and on not just, as someone said, sort of making program tweaks, but really doing the work at a systems level and thinking about it as a transformational opportunity, which it is. And a key part of, I think, that work that's really come forward and is something that you all were discussing earlier and Stephanie noted in her presentation is how critical it is for that work to the possibility of it being transformative is to be engaging and centering the voice and experiences, strengths and needs of children, youth, and families. A key next step, though, I think really related to this shared vision, I think it's a very shared vision at a 30,000 foot level, is to really be thinking about maybe more somewhere at the 10,000 foot level. What are the outcomes in 5 years, in 10 years? How is the system going to look different, and what capabilities and functionalities is it going to have? And what are the key outcomes for children and youth that we are going to see that will be different? And I think that is part of our work in the coming months, is to really define those outcomes for the initiative so that then we can work backward and we can really drive the work that we are doing collaboratively to reimagine this ecosystem and drive toward those shared outcomes to realize the vision. And part of that is going to be, setting tables where we come together as partners and collaborators across sectors in, I think, some new ways, and really do that work of reimagination of the ecosystem. Next slide, please. And one thing I should note before I dive into this is I want to just express appreciation for the work of the Commission in investing in the kinds of partnerships and collaborations across sectors, such as health and education, that is really foundational to the work of reimagining the ecosystem. We know that relationships, partnerships, collaboration, trust, trying things, right? Part of this work is we're not going to get everything right. We're going to have to learn from our efforts, and really appreciate the work that the Commission has done and funded to support that kind of foundational work that's going to be so key to this initiative. I wanted to note that this initiative is grounded in some key approaches that are captured on this slide. And I think it's important, you can see them. I'm not going to go through all of them, but I think it's important to note a few of them, because these are our anchors as we get more deeply into this very challenging work. And one is really the focus on advancing equity. The Children and Youth Behavioral Health Initiative is for all children 0 to 25. And it has a targeted universalism approach with a recognition that there are some groups of children and youth, particularly children and youth of color, LGBTQ+ youth, low income and certain underserved communities who face particular systemic and structural barriers to wellness, and that we need to have strategies and approaches that specifically address those inequities in our work of reimagining the ecosystem. As I mentioned, I think a key aspect of that is the engagement and the centering of the involvement of children, youth, and families in this work. Another key note here on this, of course, is you can see the grounding approach of starting early and starting smart, and really thinking about this work in an upstream way, although we are working across the entire continuum, recognizing that if we don't focus upstream on prevention work, that we will not be able to have in place the full continuum that we know that we need and to sustain it. And lastly, I just want to note, I do think it's very important to note the initiative does specifically tackle the issue around stigma, because we know that that is critical so that we can engage children and youth in this work, both from a prevention and service perspective. We have to address stigma. Next slide, please. Just want to connect the dots here and come back to, these are the Cal HHS guiding principles that Deputy Secretary Welch walked through earlier in the presentation. But I just want to note, I wanted to put them back up here because you can see that they are also directly related to all of the work that we do in the agency, but including the Children and Youth Behavioral Health Initiative. And I think I wanted to highlight these here because I also think it is critical to recognizing that, of course, the what of the Children and Youth Behavioral Health Initiative, the specific components of the work, are incredibly important to advance the vision and goals, but also the how. I was having a conversation with, we're doing a series of interviews around sort of expert interviews to help inform the strategy that we take to youth engagement as part of the Children and Youth Behavioral Health Initiative. And one of the folks that we were talking with, shared with me that mostly even part of the how we do this work and how we do youth engagement is part of the healing process and creating a healing system. So the how of how we approach this work is also incredibly important, as well as the what. And there's many facets to that, both what I just described in terms of our approach to equity and children, youth, and family engagement. Of how we do that really has to be done in a genuine, authentic way that supports us building a healing ecosystem. But it's also about building the capability to do systems change level work. So there's a lot of work around the planning, the collaboration, the partnerships that are at the center of this work. There's also some really key values that will build on these guiding principles of having a systems thinking and approach, focusing upstream, really continuing to make sure that we are advancing equity through a targeted universalism approach. And really, as I mentioned earlier, taking an approach of ongoing learning as the basis for change and improvement and transformation. Next slide. So this is part of the how in terms of how we really imagine that some of this work will be carried forward to advance the Children and Youth Behavioral Health Initiative, both overall and in the specific component. It is involving focusing on the entire continuum of care, really thinking about system capacity. Deputy Secretary Welch mentioned some of the work that's being done, not technically inside of the Children and Youth Behavioral Health Initiative, but that is very connected to it from a facilities standpoint, but also we know in terms of workforce, which is a key element of the Children and Youth Behavioral Health Initiative, is to recognize that we need to build the behavioral health workforce to meet the needs of children and youth. That we will be centering the experiences and needs of children and youth. We're going to specifically address stigma, and that really this initiative is a catalyst for system redesign within and across sectors. And a key part of that is really building the policy framework, the financing framework, and the systems framework for this reimagined ecosystem and its sustainability ongoing. Next slide. This slide really summarizes the major work streams that are part of the initiative. I'm going to go into those in a little bit more detail in a subsequent slide, but I think this slide is a little bit helpful because you can see how they actually do group around themes. The initiative is complex and it has many moving parts, but there really is the work of focusing on equitable access and building the foundational relationships and capacity and strategies for a strengthened and sustainable ecosystem. Really focusing upstream on prevention, raising awareness and addressing stigma, and making sure that we are using data-driven, evidence-based, outcomes-oriented approaches. Next slide. So as you know, the Children and Youth Behavioral Health Initiative is a 5-year initiative. We are about halfway through the first year. The first year is primarily a planning phase of the initiative to really develop the framework for the approach, lay the groundwork for the systems level work that is to come, and really putting in place the lanes and parameters for how we will do this work. So that includes everything from project management to and how we sort of coordinate all of these complex pieces across the initiative, but also how we engage stakeholders. What does it really look like to center youth engagement in this work? How do we really ensure that equity is embedded across all of the different work streams of the initiative? And how do we make sure that this really is an ecosystem approach and that it is both cross-departmental within health and human services, but that it is also cross-sector with our education partners, as I mentioned, at all levels, but also with many other partners in communities and in other sectors. So I think we're really, you can see the specific work here. We're really building that framework. And I think sometimes for, this is not the part that excites people, to make sure that we have the right framework in place for systems change that will really center equity and create the pathway for the outcomes that we want to achieve over time. But I think this is absolutely critical, essential work to get right, so that then as we get into more of the specifics of developing the different components of the initiative, they are grounded in approaches that will actually allow us to achieve the vision and goals. Next slide. So I know this is an incredibly hard slide to read because it's got a lot of specifics on it, but I really did want to share with you this slide because it identifies each of the individual work streams that are part of this initiative and which department within Health and Human Services is the lead entity for that work stream. And just for clarity, I think it's really important to say this does not mean that this work stream, all of the work literally only happens within that department. As I've talked about, this work is from a systems perspective, so it will involve collaboration with other departments, with HHS, with other sectors, with other sister state agencies, with other partners and communities, both at the state and local level, of course, with children, youth, and families. So I think as you look at each of these work streams, we wanted you to know sort of where the home was in terms of the lead agency and what some of the key work that will be happening under each of them is, but also that this is not meant to reinforce the silos. We're really wanting to take an approach in terms of how we stand up the infrastructure for the initiative that is very integrated. And I'm happy to answer questions, but what's really happening now in each of these is they're all at a slightly different stage because there's different timelines for each component of the initiative that was outlined in AB 133, but they are in different stages of developing stakeholder engagement plans, in some cases beginning to engage stakeholders in this work, doing different kinds of research and planning activities, in some cases really getting staff on board to do this work. But it is all in the early stages of planning and building the framework for these components to go forward. And happy, as I said in the Q&A, to answer any particular questions. I do want to note in terms of Cal HHS's role, I did mention earlier, a key next part of the work is to work internally and externally with partners and stakeholders around identifying the outcomes for the initiative from a 5-year and beyond perspective so that we can really anchor the work of the initiative in aiming toward those change goals, both from in terms of how the system functions, but also outcomes for children and youth. And related to that, another responsibility for Cal HHS in this initiative is the evaluation. So we will be developing an RFP for a partner to do the evaluation. And it will be an evaluation that isn't sort of singular in focus. It will have a number of layers to it, both in thinking about the initiative, the outcomes, but also doing policy evaluation and other components that we know are really important to help us see the impact of the initiative, but also learn from it and continue to inform the work going forward. And another key role for Cal HHS is really as the sort of spearheading the youth engagement component of the initiative. Next slide, please. I'm not going to go through these next 2 slides, but I wanted to share them with you. We have developed high-level milestones across the 5 years for each of the work streams in the initiative. And I wanted you to have this so that you could see some of the different timelines related to each work stream, which I know folks are really wanting to make sure that if there are particular areas that they want to engage in, I wanted to be able to share this information so that you could see that. And let's go 2 slides forward if we could. One more. Great. And then lastly, before we turn to discussion and Q&A, I wanted to just share, we're still very early in the planning and framework development for the initiative, but I wanted to just share some food for thought ideas on where there may be some opportunities for alignment and work between the Children and Youth Behavioral Health Initiative and the Commission. Clearly, one of them is ensuring that the initiative is informed by the learnings, the foundational partnerships, the impacts that you have already achieved through your work, both collectively, but also some of you individually as subject matter experts. The use of subject matter experts is an intentional component of the stakeholder engagement of the initiative. So look forward to being able to call on you and work with some of you in a role as a subject matter expert related to different work streams of the initiative. I have the sharing of insights here because I think we all know that systems level transformations are incredibly challenging and that much learning goes on through the work. And I know that has been the intention of work of the commission, including with the MHSSA work. And I think the sharing of insights is a really a critical component to this kind of transformative work. I know you all have done, as was talked about earlier, and as Deputy Secretary Welch mentioned, work around youth and family engagement, and we want to make sure that we are aware of the different findings that you already have to also help shape and inform the initiative, as well as the work we will be doing directly with youth and families. We're currently working on a landscape analysis, both of not only within the Children and Youth Behavioral Health Initiative, but looking within Health and Human Services and across education in particular at all levels of education, so that we can understand maybe the totality of the landscape of the map of different initiatives, strategies, funding streams that relate to work to improve the social emotional well-being and behavioral health of children and youth. I think it's really, we want to do this work to make sure we understand our starting point, not to be limited by what is today, because this is, anchored in reimagining and developing the behavioral health ecosystem that could be and that we need to support the well-being of children and youth. But so that in some ways we understand all of the assets that we have, all of the ingredients to bake the cake, so to speak, by really tapping into the fullness and comprehensive nature of all the incredible work that really is happening, unfortunately happening more in silos than we would want, but we're trying to lift that up and maybe increase our shared and mutual understanding across sectors about what the current landscape is and to utilize then that to think about what the system could be. As I mentioned, we're focused on primary prevention and population level prevention. And I know that is work that the OAC is also thinking about as well. So I think perhaps some opportunity there for thought partnership. And then also, at the end of the day, the Children and Youth Behavioral Health Initiative is about creating a state level framework that describes and supports this reimagined ecosystem. But we all know it will be executed at a local level and that there will be a range of models across the state that look different, but have shared principles and goals and outcomes that they are driving toward in terms of improving social emotional well-being for children and youth. And know that given the commission's work with communities and with counties, I think there's an opportunity there to just continue to be in dialogue around the learnings from that work. So thank you again for having us. Look forward to the discussion.
Thank you so much. Stephanie and Melissa, thank you so much for being here. I look forward to working with staff to ensure that we are communicating and collaborating closely to ensure that we are working together in the same direction to improve our mental health system. With that, I invite Commissioner Alvarez and Commissioner Danovich to make a comment, please. And then any other commissioners with questions or comments. I know Commissioner Alvarez has to leave, so please, Commissioner Alvarez, if you can make your statement, please.
Thank you, Chair Madrigal-Weiss. And I just want to say thank you to Stephanie and to Melissa for their presentations. It's clear that there is an incredible commitment on behalf of the administration to address children's and youth's mental health crisis right now, and we commend this incredible investment. But really want to also ensure that we work together to strengthen that investment and to maximize it for the future. We took advantage, the administration took incredible advantage of these one-time dollars to strengthen our system, and making sure that we do all we can to improve our system for the long haul is what we have to focus on in partnership with the commission. And you being here today is just evidence of that partnership and a commitment to that partnership, and want to applaud and thank you for that. And then I finally want to just say, and Melissa, given your background, this well, the investment in early childhood development and ensuring that we are addressing and preventing adverse childhood experiences where we can, but also creating the environments that children need to be successful and to be loved and to be able to grow up healthy, requires additional investment and prioritization. We had a conversation on that here at the commission just earlier today. And I look forward to having all of us work together and figure out what that might look like. Again, leveraging the state resources that we know are available and maximizing them for our little ones. And I have a show and tell to tell you just how important our little ones are. So thank you very much. Looking forward to next steps.
Thank you, Commissioner Alvarez. Commissioner Danovich, please.
Well, first I would echo Myra's comments, and I marvel at how eloquent and articulate she could be while taking care of her beautiful baby. I wish I could do the same. Thank you both for really an outstanding presentation. It's really a compelling vision. I know and I think I can speak for my commissioners, we would like to see this vision implemented, and also want, recognizing that it's ambitious, want to learn from what works about it, what doesn't. I think that my main point was going to be what Myra really said, which is, I'm glad you put up areas for alignment. I'm really interested in specific areas where we can help facilitate implementation and evaluation of these initiatives. And then one other thing that I'm sure is there, in a short presentation can't cover everything, but I think is really important, is that even before the pandemic, there were massive issues with burnout and despondency and demoralization about the limitations of the system. And I think it's really important for there to be a marketing plan somehow. Well, both a focus on well-being for our clinicians and staff, but also an awareness of this compelling vision so that we can move the focus to the barriers and problems in the system, to the opportunities that exist on the front lines. And this, CalAIMS and the initiative at large is complex and hard to get one's head around. So I think that we're going to need to message about this over and over again to help the various participants in our system recognize the opportunity that we do have before us and that we really must take advantage of. But thank you both.
Thank you, Commissioner Danovich. Do I have any other commissioners who'd like to have questions or make a comment? Okay, seeing none.
I'd like to say a word if I could.
Of course, please, Commissioner Gordon.
Yes, thank you so much for the presentations, and as a practicing educator, thank you so much for taking the risk to move to eliminate the silos and bring our systems together. I think that will make a huge difference in the long run, because in the end, it's about relationships, and if we can build relationships between health systems and education systems, we will be much the better for it. And I think much progress has been made already. So thank you for taking the risk and stepping up. And I think we can get this done.
Thank you, Commissioner Gordon. I don't see any other of our commissioners. So I will ask to go to public comments. And this is a reminder that members of the public should be prepared to complete these comments within 3 minutes or less. Please note, the meeting moderator will unmute your line. Once unmuted, we can hear you. So I'm going to ask Amarani, please, to begin our public comment. I see a total of 3. We are going to close it once Stacy Hiramato, I see you up first. So we will close it just in the sake of time. It is 1:09. We are 9 minutes past our time. And then I will talk about what we're going to do with agenda number 4. So please, Stacy.
Thank you. Thank you, Chair. Stacy Hiramato with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. It is great to see Stephanie Welch here. For many of you commissioners, at the beginning of this commission over a decade ago, Stephanie used to come here on a regular basis as a member of the community to give testimony, and we were always happy to be next to her. And so it is wonderful to have somebody with the commitment and the knowledge that she has in a position in the agency to be an advocate on the inside for us. And Stephanie, your presentation was excellent. And thank you so much for taking the time to make this presentation to the commission. This is the first time that I've had the pleasure of listening to a presentation by Melissa Stafford Jones, and I was delighted. It was so refreshing to hear you talk about disrupting systems, acknowledging white privilege, and some of the things that we've been saying for many years, but to have someone, again, in your position to acknowledge these things and want to address them. I do want to just say two things, one specifically and one in general. One in general, I noticed that you do talk about community-defined practices or community evidence practices, along with evidence-based practices. I just want to make sure that it does get at least equal weight, because speaking on behalf of communities of color and other underserved communities, those are the practices that we find work well and best with our communities. Also, something in specifically, the Health Equity and Racial Justice Fund, which is being sponsored by a number of community-based organizations, including CPEN, Latino Coalition for a Healthy California, the Public Health Advocates, and California Black Women's Health Network, as well as others. This initiative would take $100 million from the state budget to establish the California Health Equity and Racial Justice Fund. Our fund seeks to transform community conditions and institutional government systems to promote health equity and racial justice and reduce specific health and social disparities that impact communities of color and low-income communities. This is a major effort with so many of the organizations I know. I'm hoping that the commission will support this and that the administration will support this also. Thank you again.
Thank you, Stacey. Hector, please.
Your line is open.
Hello, good afternoon. Hector Ramirez, Los Angeles County. I also want to take Stephanie and Melissa for their presentation. You know, as somebody who's been a stakeholder involved in this process, I was completely shocked to participate in stakeholder processes with them and actually have them listen to the suggestions that I was bringing forward. As a stakeholder, as a beneficiary, as a person with a severe mental illness, that rarely ever happens, even though I have been, advising. So I really want to thank them for doing that. It is very evident all throughout their presentation that the plans that they presented for really had community focused ideas, because I know that's how it was really done. The level of community engagement, the level of participatory design was really, really clear in the outcomes. When Klein was launched at the beginning of the year, I was totally in shock of just how responsive their departments have been to the needs of our community, particularly throughout the COVID pandemic. And that's why I really wanted to focus on Melissa's, I think it was Melissa's presentation and the accountability slide where she showed some of the principles. And I wanted to remind that just as we're talking about accountability, it was the focus on equity slide. And one of the things that I thought that was really missing from those particular points was accountability, because no matter how much, I mean, we look at this particular vision, no matter how much money we throw into systems, if there's no accountability, if there's no oversight, there's really no equity. And that's one of the things that we have seen throughout the pandemic. It's not only that we have had a lot of systemic inequities, but that the lack of oversight and accountability has really laid waste to queer, disabled, Black, Indigenous, and other people of color, particularly our Hispanic population and our Hispanic youth, have suffered because of the lack of oversight and accountability. So I really wanted to stress those particular factors within your presentation. I know that they're embedded throughout the programs, but I think it's important for communities, particularly those of us who have been overly marginalized and sometimes censured from speaking in these public forums, to really have those particular elements be out there to ensure our communities that we're not just repeating the same mistakes and that we're really moving forward, so that the communities can begin to heal and regain trust in some of these processes that have, for years really contributed to some of the disparities, particularly for young folks. So once again, I was really appreciative of the presentation, and definitely thank you for the considerations, and hope that that level of community participation can be one of the things that perhaps this commission could really perhaps take as an opportunity to enhance the stakeholder engagement, who has been really, unfortunately, disenfranchised and at times really not really appreciated, which is really unfortunate. So I thank you for that.
Thank you, Hector.
And the last commenter, Pashi, your line is open. You may go ahead.
Thank you so much. I feel so honored being the last public comment today. So Pashi Walker, pronouns theirs. Stephanie and Melissa, thank you so much for your presentation. And I'm going to try and make this quick. I just wanted you to know that at the beginning of my career, youth ages 12 to 17 had to have parent consent in order to have mental health services. What that translated to was that I had a young man call me who was gay, but his parents didn't know, and he wanted mental health services. I had to ask him if he was currently suicidal. And since he was not, I had to tell him to come back when he was, because at that time, a youth could only consent if they were at risk to themselves or others, or if they were victims of sexual or physical abuse. In 2009, Senator Leno, the NASW California, and Cal Voices collaborated together, and we did get legislation passed that allows 12 to 17-year-olds to consent to mental health services if, in the judgment of the clinician, contacting their parents would be negative to them. And there's lots more in the bill I won't go into, but because it was 2009, if you all remember what was happening back then financially, we had to add one more thing to that bill, which was that Medi-Cal would not be included. And so while Medi-Cal minor consent will cover all kinds of things for 12 to 17-year-olds who cannot get or are afraid to get parental permission for certain addiction services, for reproductive services, et cetera, and they can not only give consent, but can get covered. That is not true for mental health services. And not only is it not true, but then the messages that come down to agencies that might serve these youth, they're not told that as long as they aren't billing Medi-Cal, they could still give services to youth for mental health without parental permission. And so I think it's time, and I'm hoping Stephanie and Melissa, maybe there's a way to work with you offline, and that also the commission might support these efforts. I think it's time that our most vulnerable youth, those that are on Medi-Cal, do have the ability that if they can't get parental consent, and this includes not only LGBTQ kids, but it affects kids of recent immigrants. And we were just talking about that population today, and also BIPOC kids, Black and brown kids, kids who come from homes where mental health services are not okay. And so the only way they're going to get that support, whether it's in school or privately or whatever, is through being covered by Medi-Cal, or at least being able to access at an agency that could give them those services. So I know, Stephanie, Melissa, if you don't know how to get a hold of me, I know that Lester does and other people do, and I really would love to work with all of you and correct this and allow our most vulnerable population to get services when they need it, if they cannot, or it's too dangerous to them to get parental consent. Thank you so much for giving me this time, even though we're running over time. Thank you.
Thank you, Pashi. So at this time, again, I want to thank you, Stephanie and Melissa, for being here. It is 1:19. We are over time. At this time, we will postpone item 4, the budget update. We will post it online to share it publicly, and we will work to reschedule the budget presentation for a later date. We have had important discussions here today, and this has been a productive meeting. I'm sorry we went through our break just to keep things going. I want to thank everyone here today for being here, particularly members of the public. We value your input and participation. Our next commission meeting will take place on Thursday, February 24th. So we look forward to seeing you all again soon. At this time, I would like to adjourn this meeting in memory of our friend Commissioner Tina Wooten. Take good care of yourselves, and we will see you next month. Thanks, everyone. Have a wonderful day.